My name is Julia. I am the CEO of Unicorn Web, and our team is passionate about entrepreneurship and venture capital. We have been engaged researching and supporting startups from different areas for more than 5 years. And last year, we created Biohacking Congress. It is the platform which is dedicated to furthering the advancement of biohacking, health optimization, longevity, biotech, digital health, healthy and ecological companies. We believe that biohacking is powerful and can make positive changes to each individual and globally. That's why we build this community for meeting, exhibition, exchange opinions between scientists, biohackers, experts on health optimization and longevity. And we invite you to join our global community and attend our virtual and on-site events. We plan on-site Biohacking Congress in Silicon Valley at the end of this year, and our big virtual Biohacking Congress will be very soon. You can find announcements on our website, biohackingcongress.com. There you can learn from first hands, you can meet like-minded people, friends and partners. And if you are not biohacker yet, you actually can start your biohacking journey for health optimization, performance optimization, well-being and longevity. So please join. One of the purposes of Biohacking Congress is to promote beneficial cooperation between entrepreneurs and investors from biotech, HealthTech, wellness industries. If you are an entrepreneur and would like to leverage our global community to get your brand awareness, visibility to industry investors, and raise money for your current venture faster, please apply on our website at the section for startups, or just send me your investor deck and I will provide you with feedback. For venture capitalists and corporate venture capitalists who like viewing these sectors as the frontiers for delivering returns, we would be happy to present a short list of suitable investment opportunities, as well as help you to close next round for your portfolio companies. If you have any questions about this, please ask me or my partner, Nick. We are excited to help the brightest minds that solve the planet's biggest challenges through disruptive solutions and technologies and make human life more ecological, healthy, and happy. And we invite you to join us on our mission. Today we host this networking event, and attending our events for venture capital market participants is a great opportunity to be heard by ecosystem, to hang out with fellow investors and cool entrepreneurs. Today we have co-organizer of this event, Coherent Capital Investment Banking and Investor Relationship for Disruptive Solutions. We are grateful to our co-organizer. Our event will be started with a panel discussion about innovations and investment in biotech, longevity and health tech. Very soon I will introduce our great speakers. The second part of the event will be pitch session of 5 selected startups. Each pitch will be followed by Q&A session with invited investors. We are grateful to all investors who have joined us today. Thank you very much. And we are honored to have such great funds with us today. These venture funds and corporate funds just a part of our network. Generally, we have more than 200 funds in our network, and we invite them to our events. So now let's start the discussion, and I would like to invite to our virtual stage Max Damkov, partner, Thought Act Ventures, Adam Daking, managing director, DreamIT Ventures, Megan Krause, partner, Amplifier Ventures, Günther Bruggenwerth, Life Hub UK, Lead Radiology, AI and Open Innovation, Bayer AG, and Kate Barnes, managing partner, Longevity Capital. So, Mick, please make all speakers together at our virtual stage.
And we are good, yep.
Okay, so Please, let's start from short introduction, and all speakers, please introduce shortly yourself. Let's start from Adam Dakin.
Hey, good afternoon, Julia. Thanks for the
Yeah.
invitation. Great to be here. Always a great panel and a good conference. So I really appreciate the invitation. So Adam Dakin, Managing Director of Dream It Health. We are a venture fund in Philadelphia. We focus on urban tech, secure tech, and health tech. My team is the health tech team, and for us, health tech means medical devices and digital health. We really don't stray beyond those two verticals. Our focus is late seed Series A companies. We're a little bit different than traditional venture funds in that we run what you could loosely call an accelerator. We call it a growth platform, where we work with a very select number of companies twice a year, typically 6 to 8 companies out of the 400 or so that apply. I like to call this a sleeves up venture fund, because what we do with those companies is we connect them to a very large stakeholder network of payers, providers, large multinationals, big pharma partners, get them red carpet access to decision makers to really accelerate customer acquisition. And then we do the same thing with our investor network, nearly 1,000 venture funds who look at our cohorts and then are kind enough to meet with those cohorts when we do what's called investor sprints. Historically, about half of our companies close an institutional round within 6 months of going through Dream It, and then we co-invest in the vast majority of those deals.
Thank you very much. Max Zankov, please, your turn.
So my name is Max Zamko, and I'm a partner here at Third Act Ventures, where we invest exclusively in companies in age tech. So that means any company whose primary goal is to make life better for older adults and or their caregivers, they can live happier, longer lives. That's what we do, all at the seed and Series A stage.
Nice. And Kate?
Yes, good morning, everyone, and greetings from sunny San Francisco. So I'm a managing partner in Longevity Capital, which is part of Deep Knowledge Group, which comprises of a number of organizations, both commercial and nonprofit. And we're active on many fronts, ranging from scientific research, analytics, investing, philanthropy, and related spheres. You might have heard of us under different names because it's a group of companies. Deep Knowledge Ventures founder is famous for establishing a $1 million prize to a person who lives up to the age of 123 years, because the current record is 122. One of our flagship investments back in 2014 was in silico medicine. And our view of longevity is something very simple. It's living healthier for longer within currently known human lifespan. And I will elaborate later on our investment thesis and what sectors are of special interest to us. But going back to Max, because he mentioned age tech, so that is a sphere that's also of interest to us, in addition to geroscience, P4, and other sectors that we will focus on. And briefly, Longevity Capital is a new fund that we're raising, because Deep Knowledge Ventures, the original venture fund, started in 2014. So Longevity Capital's projected size is 100 million, and we're in the process of fundraising right now. It's a pleasure to be here and meet everyone.
Thank you very much. And Megan, please. Please.
Hi, I'm Megan Cross. I'm a partner at Amplify Her Ventures. We are a seed stage fund based in New York with the whole mission of getting more exceptional women into the C-suite of high growth businesses. And we do have a big focus on care, specifically care at different inflection points in life. So we've made a handful of investments in the longevity space, both on the B2B software side, helping the healthcare industry have greater efficiencies, as well as on the consumer side of enabling people to age with more ease, for lack of better words.
Thank you very much. And Günther?
Hello, everyone. Good morning and good evening. I'm sitting in Berlin right now in Germany, where it's 8 o'clock already, 8 p.m. I'm working for Bayer. Bayer is a life science company, farmer and crop science, and we're building up a pretty big digital agenda at the moment and focusing more on the on AI solutions, artificial intelligence solutions. This is why we opened the LifeUp UK last year in October in Reading, which is near London, and I'm heading the radiology part there. I'm a radiologist by training. What we're doing there is focusing on AI solutions for imaging. That is, we want to enhance and enable radiologists for their diagnosis when they look at images. And also we are looking to answers how to predict a response or the outcome of patients when they have received a CT or MRI, for example, cancer patients. So this is actually our focus in Reading, UK.
Mm-hmm. Yeah, thank you very much. And I thought that you work for Bayer UK, correct? Or but you're located in Berlin. Okay.
I'm located in Reading in the UK, but I left the UK mid of March because of the COVID crisis. And now I'm stuck in Berlin. So I'm really looking forward to go back, I guess, after the summer break in end of August.
Mm-hmm. Okay, thank you very much for these introductions. It's so good to learn a little bit more about our speakers, and let's start the discussion. As you already understand, we believe that one of the biggest investment opportunities over the next decade probably will be to longevity and companies which work to improve health spans, enabling humanity to live free of disease and very long. According, for example, to Bank of America analysts, a market expected to be worth at least 600 billions by 2025. So let's see. My first question to you about what are the latest technologies and solutions enabling longevity and higher quality of life? And firstly, I would like to address this question to Adam Dakin and to Max Zamkov. Please, Adam.
Sorry about that. So we're excited, obviously, about technology that enable higher quality aging in place. And I think there's certainly a lot of technology out there. We don't really invest much on the drug discovery side. So not so much in molecules or pharma that would actually extend life, but we're more focused on extending quality of life, if you will. And certainly on the software side, there are a lot of in-home technologies that will monitor the sort of the health or physiologic status of a patient and then alert providers or family members when the patient is potentially decompensating, enabling an earlier intervention. So we think there's a lot of exciting platforms there as well. Technologies. Sana, who is going to be presenting today, is one of our portfolio companies. It's a relaxation and pain relief platform. Obviously, that's pretty important as you get a little bit older in life and the aches and pains start to creep in, or they even go beyond aches and pains to the point where they're debilitating chronic diseases. So I think those kinds of platforms are going to be very important, and we're really excited to be an investor in Sana as well. I think the one key point that I'll make, and then I'll turn it to Max, is we look at a lot of stuff, and I think the key part of this is that the operational lift has to be very light. We see a lot of technologies that are really exciting for home use, but they require like an in-home installation and equipment. And that can almost, by itself, that can almost be a showstopper, because if it requires that sort of, operational support, it affects the margins, it requires a support team. So, platforms that utilize existing technologies like a mobile foam, or we're also excited about a company called Stel. It's a plug-in in the home, but it makes everything run automatically. Those are the kinds of things that we think are a lot more exciting.
Okay, and so Max, what is your answer?
Thanks. I'm actually going to just kind of continue what Adam was talking about, particularly about the point of anything that requires an installation in home being challenging, not only from an expense, not only from a support standpoint, but also from an expense, right? In order to get people in the home. I mean, one of the biggest issues right now is that care at home is incredibly expensive, particularly here in the US. And so some of the things that are most exciting are the things that are enabling better care to happen at more affordable prices. So using virtual care, using telemedicine, using remote patient monitoring to allow home care agencies to provide higher levels of care to ensure that their clients are as healthy, if not healthier, while not requiring as much individual person-to-person use, being able to provide that over the internet, over the phone, and really scale their operations. The other thing, honestly, related to that, that's most exciting and is done the most in terms of extending health span, and I love that term instead of lifespan, because it's really about how long you're healthy. You know, living those last years in pain is no fun. But honestly, the things that have been the most beneficial are Uber, Instacart, all these on-demand services that are allowing people who may not be able to drive anymore or walk to the supermarket, get their groceries, get out, see friends. And particularly now that in the US here, the social determinants of health are being reimbursed by payers, all of these new technologies that are based off of that are really coming up and exciting. So anything that you need to do in order to be a regular human being, that technology is now able to help bring someone into you and get you that help you need without you needing to give up and kind of move into an older adult home.
Good. And what can you say about the future of food, which is actually advance sustainability of planet, not just better living? So maybe you would like to add something about such aspect of technologies for longevity.
Sure. I don't know much about the food area, besides that in general, food for older adults, particularly when you enter a nursing home, is awful. But I mean, that's the benefit of the on-demand economy, the sharing economy, right? The more we're able to share resources, the less waste we produce, because the amount of food that we waste is just untenable. And we could be providing so much more food and food security to a lot of people. Here in the US, Meals on Wheels does a great job of that, but there's still a lot of people that they can't service. By partnering with some of these new on-demand services, they're able to extend their reach even further without any additional cost or complexity, which is really great.
Good. And Kate and Megan and Günther, would you like to add something about this question, according to this question?
Sure. I mean, one thing that we look at is just mentioned earlier, the efficiencies in the industry, and how we can tap into, or how different technologies can tap into where there are cost savings to be had. So whether it's the providers being able to streamline their communications with patients, or through different types of software technologies that we've seen, or through the back-end solutions of the senior nursing facilities themselves. We see a lot of the business infrastructure capabilities that new technologies have as having a great ability to pass over the efficiency to the patient, him or herself, and as a result, taking a lot off the plate of them and their personal caregivers too. I can give examples, but that's one approach to how we're seeing it.
Good. Günther, would you like to add something?
Probably when you talk about food, you should also talk about how you would produce the food. And this is actually something that we do at Bayer. We have our digital agenda, as I was mentioning before, in leveraging the areas on the field for an optimum output. So you have, for example, some drones looking at the fields and analyzing the field structures, because a field is not a field. It has different areas and different capabilities, how to grow and how you should work with the plants. So this is something where we think is a lot of potential for optimizing. It's not my specialty. I'm a radiologist, as I said, but this is something we're very much engaged at Bayer as well.
Okay, Kate, would you like to add something?
Well, I'll just add a side note that part of our investment thesis is investing in companies that either possess a technology that's either immediately available or will be available in relative near term. Because in longevity, let's say if you take geroscience, there are lots of moonshots, so to speak. So our objective is something that is either immediately available, and HealthTech is a fantastic example, right? Because it's improving lives of currently living older people. And if we take global population, it's like 1 billion people in retirement. So that's a huge number and a market opportunity. And people's lives can be improved immediately. So that's just a comment that it's extremely important. And there's a lot of things that can be done immediately, as in right now, and have profound effect, on the aging population and humanity as a whole.
Yeah, and also to combat with such diseases as Parkinson, Alzheimer, and so moon technology, moonshot medicine.
Which are of course important. I'm not going to negate that. It's just we focus on something that's more near term available in our case.
Mm-hmm. Yeah, thank you very much. And my second question would be, how has COVID-19 changed research and capital flow in epidemiology and virology and in healthcare? And here I would like to emphasize several aspects that here has been a dramatic shift to telemedicine. And now science focus on new technologies to effectively detect and treat disease, encouraging more emphasis on preventative care and engagement of patient and remote patient monitoring. So I would start with answer from you, Kate, about this. How has COVID-19 changed healthcare?
Sure. Well, I think there's a twofold answer here. Number one is there is a...
Kate, could you please always talk with microphone, because it's sometimes, yeah.
Sure. Well, sorry about that. Can you hear me now?
Yes. No.
Great. So I think aspect number one here is that there is a reinforced focus on the importance of human health. So biotech is obviously one of the leading spheres that was obviously a popular sector to invest previously, but right now there's a heightened interest to it. And then secondly, many investors who were, let's say, focusing on traditional assets such as real estate, entertainment, travel, which are not the hottest industries as a result of COVID. So they need to refunnel their investment funds, in view of the situation. And I'm sure everyone knows, but since the start of the pandemic and the lockdown, so let's say we take middle of March, actually there was lots of funds, raised both by private companies and received by, venture capital funds such as Commun Capital, Arch Ventures, and a number of others. I also think that such aspects as preventive medicine and enhancing immunity, especially for the elderly population who are the most affected by the pandemic, are going to be a specific focus. So pretty much this is a brief summary. So I think it's good news for longevity industry as a whole, because I think more people are realizing that, the most important thing is health, and health is new wealth. And this sector will be, growing, and which will benefit everyone.
Mm-hmm. Thank you. Megan, what is your answer? How has been changed healthcare after this pandemic, during this pandemic?
So there's a number of ways I'll chip away at that answer. There's an expedited sense of urgency around R&D for a few of the companies that we've invested in and others in the space, which I think is very exciting. And there's more resources being put towards companies that had a real need to exist and or addressing a real pain point, and now have have the floor in sense. For example, Max and I are both invested in a company that is mitigating hospital-acquired infections through DNA sequencing, next-generation DNA sequencing, in order to identify which pathogens are where in hospitals. I mean, this is a problem that really not enough people know about, and it's so detrimental to the older adults in particular who are in and out of hospitals. And I think they're very heads down in our right now, and it'll be exciting to see what comes out of that. There was also a whole other slew of product offerings that we're very excited about, such as the artificial intelligence softwares we've invested in that can basically preempt acute episodes. So through this connectivity now of, through the need for everybody to be remote over these past few months, there's been a greater focus on development of connectivity in bringing care providers together with their patients virtually in more seamless ways. And because of that, just older adults who otherwise would just be aging in place with a lot of risks attached to that, are now aging in place with more resources to be monitored and to be cared for to preempt acute episodes and perhaps hospitalizations. So those are just a couple of ways that we're thinking about the effect. It's surprisingly an optimistic answer to a very difficult time, but some of the effects that COVID is having on longevity tech.
Mm-hmm. Good. And Günther, I know that you have some interesting case in Bayer now you are working on during this pandemic. Please tell us about it.
Yeah. Thinking and talking about COVID, that's really exciting. And I nearly don't know where to begin because it's such a big topic. Probably I focus on the way how it changed our working mode. So this came really out of the blue. And as Megan said, everybody is sitting at home online, connectivity is a topic. The good thing in working here on projects for like R&D, research and development, what we are doing, is that everybody was reachable. There was no problem set up any meetings, and everybody is basically having the same goal, and that is fighting the disease. So this was really a global alignment, what we sensed there. And the way we worked changed dramatically, and also the speed. So the project that we began there, and also searching for partners, getting data sources like images and clinical data, all this went very, very speedy and quickly. And the results are nearly there. So normally you have, for a project, you start planning the project, and then you're looking for partners, and you have endless discussions on how to move forward. All this is focused on a very speedy way, and not only within our company, but globally. No matter to whom you talk, it's speed. And I think this is, for me, the most important change that I see with COVID-19, and probably we will keep that speed, not at that pace, at that intensity as we have seen the last months, because things are getting to normal now. But I think that will be a very important change.
Mm-hmm. Good. And I also would like to learn your opinion, Adam and Max. What about this situation with pandemic? How has healthcare changed?
Well, I mean, the obvious one is telehealth, right? That's been beaten to death. But we know that the pandemic kicked down all the doors for the barriers to telehealth, right? The reimbursement side, doctors wouldn't do it because they didn't get paid. Now they get paid to do telehealth. Doctors couldn't practice across state borders. That's gone. They can do that. So, the telehealth door has been kicked wide open, and I think people are well aware of that one. I guess the more, maybe less obvious changes are around the patient experience and the patient demand side. So now that telehealth has been generally more accessible, I think patients are starting to demand it more, and they're getting used to it and much more comfortable with it. I look at my elderly mother who, she wanted to go to the doctor. She wanted the white lab coat in front of her. She wanted the doctor's hands touching her so that he would make the right diagnosis. But she's now done a couple of telemedicine visits, and she was quite comfortable with them. And she didn't have to schlep to the doctor's office. And she didn't have to have the anxiety of being in a doctor's office and worrying that the person 6 feet away might have COVID. I've noticed that same thinking now extends to, going to the hospital, right? So the hospital at home, I think this also is the wind at the back for the hospital at home, because patients realize the hospital is actually the worst place to be when you're sick, right? So they're demanding care, at the home. And then when I think back to my mother as well, you talked about aging in place earlier. Older people didn't want to go to nursing homes or assisted living facilities before, but now we've given them the perfect ammunition not to go, right? I mean, this is not where you do not want your elderly parents in a nursing home where they can be exposed to things like COVID and pandemics. So again, I think it's going to create much more demand on the patient side for technologies. I mean, look, everybody wants to age at home, but that was more for pride or self-esteem or family, or there was a family convenience issue. But now with the pandemic, people have a very legitimate, defendable reason to say, I am not leaving my home.
Yeah,
Okay.
I don't have that much.
Well, you would like to add something? Yeah, just
Sure.
was going to ask you.
Much more to add on top. I mean, it really is what you and Adam were talking about. Telehealth is the biggest one, then moving into remote patient monitoring. I'm really just moving healthcare into the cloud, which is amazing. The one thing I'll say is that in this industry, because of COVID, which is a terrible reason for it to happen, but there's been over, they say, like 10 years of technological progress in terms of reimbursement and forward thinking that we had over the span of 10 days. So it's really been amazing from that perspective.
Yeah, thank you very much for such positive view at the end of this question. Thank you very much. I see that we already have some questions from guests, and before we switch to questions from guests, I would like to ask the last question. What are the key trends that you see in digital health, longevity tech, and biotech to invest in? You actually already answered a little bit from the very beginning, but one more time, and together with this, maybe you will tell us about regulatory challenges for such startups in the US. Adam, would you like to start, or who would like to answer first?
I'm happy to start out. So I can't talk to the regulatory challenges because my knowledge of how the government works is trying at best. However, what I can say is that, besides all the things we've mentioned so far, from telemedicine, remote patient monitoring, another huge area of opportunity all over healthcare is in staffing. All over the US and really the world, there are not nearly enough healthcare workers for the type of care that we need, particularly now that as a globe, we're all getting older. And there is not enough nurses, there's not enough staff. So anything that's doing something to alleviate that, whether it's getting more staff in, whether it's finding ways to make them feel more appreciated or better trained so that they don't leave, getting people to more easily fill shifts that are left open so they can keep wards open that they couldn't otherwise, and keep taking good care of the people that are in the facilities. Anything that can make a dent in staffing is doing very well right now, and there's still a lot of room to grow.
Mm-hmm. Thank you very much. Megan, what about you? Your opinion?
I think, well, just to reiterate what Adam said, I think that this time has brought much needed expedited process to deregulation of telehealth. And I think in a sense, actually, telehealth has become a lot more commoditized. And so one thing that will be interesting to look at in that sense is just the picks and shovels of telehealth and how there can be innovation to make this process that really is commoditized more seamlessly integrated into everybody's day-to-day process. And then also on the regulatory, well, not so much regulatory, but just one of the hurdles that will be interesting to see what comes out of all this is basically the databases that exist right now and how we can, I think somebody actually made a point of asking about it in the chat, which is just how we can find this balance between privacy of information and the utilization of information to actually improve the technologies that exist.
Okay, and Adam, please tell us how do you think, what is key trends that you see for investment in these areas for your fund?
Yeah, I mean, maybe I'll go backwards and just make a comment on the regulatory piece, because I think, you know, Megan made the point, like a lot of the regulatory barriers have been knocked down, certainly on the telehealth side, but I think even on the digital health side, it's got a lot of companies thinking they can play fast and loose on the regulatory piece. And we talk to lots of companies and they almost just brush it off. It's like, oh yeah, we're not regulated. You don't need to worry about that. We can just get our product to market. And you know, that's sort of maybe being clever at the expense of being smart. Maybe it's true. Maybe you actually can get into the market without being regulated. The question is, do you want to? Or you know, regulation is really all about what claims you can make for your product. And if you want to make sort of medical, clinical grade claims that you diagnose a disease or you treat it better, that crosses you over into being regulated most of the time. There are exceptions. But those are the claims you probably want to make when you're standing in front of the provider. And you're not going to be able to say those things unless you go through the pain of applying to the FDA, telling them what claims you want, giving them the evidence that you actually do meet those requirements. And that's what you want to go out and sell and market. So I know we have partners, for example, we have some big pharma partners that actually won't invest in a digital health platform if it's not regulated, because they feel like, oh, okay, that puts it up to a higher standard. This is not a consumer sort of toy or a platform, it's medical grade, and the company must believe in it if they're willing to go through the pain of getting an FDA clearance or approval. And by the way, that creates a great competitive barrier to the next company that comes in behind you, right? They're going to have to demonstrate that same level of safety and efficacy to get their product on the market. And then again, customers will have a lot more comfort when they know that you've gone through that process. So I think there's a double-edged sword to the regulatory side, because, you know, COVID had, you know, sort of the wild, wild west for a little while, particularly with the diagnostic side. We could argue whether that was a good thing or a bad thing, because it certainly increased the, you know, the accuracy of some of these platforms is clearly at question, and probably they wouldn't have gotten away with that if they had actually gone through the rigor of an FDA process. So I think the regulatory piece is interesting. FDA still hasn't figured out where they're going to land software as a medical device. They provided some guidelines for that, which are really helpful. And if you are a digital health platform, you should really be well versed in what those requirements are. And now they've moved to a self-certification system. As a digital startup, you really need to understand what that means and what you need to do to meet those requirements. If you don't, you should get a good regulatory consultant who does. But that's kind of the view. And then again, on the investment side, I just really think the opportunities of helping people age in place and do it in a healthy way is going to be just a huge opportunity. And we're really just at the beginning. The whole focus here has historically been remote patient monitoring for chronic diseases. Like that has been where our focus has been, and that sort of ship has sailed. It's the most crowded space you could possibly be in. Providers do not want any more point solutions. Do not show up and tell me about your diabetes, your hypertension, or your asthma platform, because I want all that from one partner. Like I want one bill, I want to deal with one vendor, I want one IT integration, and I want to make one phone call when I have a problem. So I don't care if you actually have the greatest hypertension platform in the world. If that's all you do, I'm probably not going to get that excited about you. So I also think there's a lot of opportunity out there for platforms that truly are the integration hub for all these disparate point solutions.
Mm-hmm. Thank you very much. And I also would like to ask you, Günther, I know that your CVC is not the same as a venture fund, and I guess that maybe you have your specific criteria for investment or acquisition, and do you see in Bayer that what is reason to invest, not just delivering return, but maybe something else? What is your strategy for this?
Yeah, that's a very good question, and that's certainly one of the most important topics that we have when we're looking for partners, for example, in our AI development. And what Adam just pointed out, the regulatory pathway is really difficult, and you need really, it's a long run. You need money, you need funding, you need expertise and everything. So this is not something and speedy, as I was saying before. The speedy thing is the development of the models itself, but going through regulatory and especially FDA, that's totally other topic. So what are we looking for when we are developing AI solutions in the imaging space where I'm working? So we are looking for partners that have certainly outstanding ideas, that have something that is probably not on the market yet. So we're looking for new ideas in this arena. And if the idea is not new, and there are already competitors, which is also very often the case, then there must be a story behind how to leverage this and how to combine this potential partner with our platforms that we have, so that we have a good fit. And I think the idea of having one single platform, what Adam just was talking about, I also think that's the future. So the customers don't want many partners to deal with. They only want one. So, I mean, ask yourself, what are you doing when you're searching in the internet? You go with one platform, and that is probably Google or another one. So most of you are taking Google. And that's the same in that space. You don't want many partners to deal with as a patient or a customer.
Good, thank you very much. Maybe you can say us what's innovation or solution exactly looking for now?
Well, I cannot go through our portfolio here, which is in development, and not all of it is publicly available. But what we're doing is on the general space, or generally speaking, enhancing on the diagnostic piece. Like, there are hidden informations on computed tomography images which you cannot see with the naked eyes. And this is called radiomics. So you have hundreds of features that is analyzed with certain techniques. And you can also combine this with genetic data, and then you have even more chance of probability to predict the outcome of the disease. So this is actually the space we're in, and this is what we're interested in also for partnering.
Mm-hmm. Thank you very much, Günther. And we have only 15 minutes till the end, and we have two questions from our guests. So first question, actually, dear speakers, can you see this table? Yeah, you see. Okay. So the first question, where is nutrition on the importance of health? Who are the leading companies that are focusing on quality non-GMO foods, and tie in entire discussion of food distribution? So who would like to answer this question about nutrition and non-GMO food? Would you like to answer? Dear speakers, please be active. Who would like to answer this question because it is addressed to all speakers?
I can try doing so, even though this is not our, precise focus. And let's say we can address the nutrition aspect. I've mentioned earlier that our focus is health span, and also with an emphasis on technologies or therapies that are either immediately available or will be available in near term. One of the sectors that we're interested in is the so-called P4 medicine. It's preventive precision medicine, and nutrition would obviously be part of that, such as, let's say, microbiome engineering and related aspects of that. So it is definitely an important aspect of human health, and it should be incorporated in, let's say, the health monitoring aspect of a person, because it affects our health greatly. And obviously the foods should be, of, good quality and, healthy balance of, fats, proteins, and all that. That briefly is that, because it's, nutrition is part of human health. And if we properly trace it, we can improve health outcomes. And also, speaking of nutrition on policy level, because we've done some policy work through our analytics subsidiary that's called Asian Analytics Agency, and we've actually established an all-party parliamentary group in UK Parliament on longevity, and United Kingdom thankfully is very focused on increasing the health span, let's say by 5 years, but I think it's a good goal, and we were instrumental in the accomplishing of that. So I think on policy level, speaking of nutrition, it's important to regulate certain aspects of food industry and make it healthier, for general population. Because, I live in the United States, we know that about 20% of GDP goes to healthcare. At the same time, the health span is the shortest compared to other developed countries. And I think that nutrition has a lot to do with that, and we should transition from, sick care to preventive care. Nutrition being part of that from early age.
Anybody would like to add something? Megan, yeah?
Yeah, so we don't do a ton of food tech, but coming at nutrition, coming at from a nutrition perspective, we're seeing a lot of innovation in terms of how people can have greater transparency into their day-to-day nutrition levels. So whether that's at-home diagnostics, at-home tests that you can take, blood tests, saliva tests that are mail-in. We're optimistic about where the innovation is and research is as to how people can really have greater insights into their day-to-day vitamin levels and how they can also take control over that. So being proactive with the use of something as simple as an at-home test is something that I think will be an important piece of where nutrition is going.
Yes, thank you very much. Anybody would like to add something? No, okay, so one more question. Telemedicine is now widely acceptable. My impression is that the next step to expand telemedicine will be remote exams and remote blood tests. Are there any more trends that you are seeing in healthcare delivery? We also a little bit discussed it already, and maybe you would like to add something, some trends.
Yeah, I think that's probably I take that up or start. I think this is a very good question, very interesting development that we can see here. So it's not only about blood pressure or things like that. It's the combination of all sorts of biomedical markers that you can think of. So it's already analysis of the eye background, for example. So there is already a device out there where you can, with your mobile phone, analyze your background of the eye, making a photo. Everybody can do that. So you could combine this with, for example, the way you move. The way you move can be a hint that you're developing a rare disease or whatever, you know. And then you combine it with blood pressure, you combine it with the respiratory rate that you have, with temperatures, with, you know, walking distance and so on. So I think the future lies here in the combination of all these biomarkers that I just pointed out and many more.
Mhm. And you said that better to have opportunity to measure all this without some special devices, just using a phone and some devices which you can take just from shop, let's say, yeah, from pharmacy.
Exactly.
Yes.
Exactly.
Yeah.
So
Okay. And one more
The focus,
No.
I mean, the focus has really been on what data can we get from the patient while they're in their home, right? So can we do a blood test at home? Or can we automatically get their blood pressure and their weight, you know, all these factors. But that stuff is probably going to get commoditized relatively quickly, I think. It already moving in that direction. The connectivity of those devices is still a little bit challenging, but we have a company called Stella. I think they're going to solve that problem. That's solvable. I think to Megan's point earlier, a lot of the opportunity is around the pick and the axis for this stuff. Okay, so for example, if we're going to do a lot more telehealth visits, you know, we've got a company that really automates the data collection process for the physician before they ever even get on with the patient. Right? I don't want to spend 10 minutes getting your history, right, and asking you, you know, all the typical questions of your medical history. That stuff should just pop up on the screen and it should be analyzed for me. And the AI should have already surfaced what's important and what I need to know, and already maybe made a suggestion as to here's the likely differential diagnosis based on, you know, what the patient already told me. So instead of a 20-minute telemedicine visit, you know, I can do this visit in 5 or 10 minutes, right? So I think there's a lot of opportunities for platforms that sort of look at the workflow piece of the remote patient engagement or the remote delivery of care and make those more efficient.
Yeah, so artificial intelligence should analyze all this information even before patient came to practitioner, and just practitioner will have general information from the very beginning, just from first level. Yeah, good. And one more question for those who focus on age tech. Do you see wearable technology as a major player in improving the age experience? Yeah, we already discussed a little bit that better don't use some wearable and just use some simple things, but what do you think about wearable devices?
I can start with this one.
Yeah.
I think that they certainly will be a major player in the prevention of a lot of this and the increase of health span. But we've had wearables for 10 plus years now. I don't even know how long the Pebble came out, and Fitbit's been around forever. The biggest issue is not actually in the technology inside the device. It's actually in getting people to wear it, getting it so that there's this wearable that the actual person who's wearing it gets some benefit out of it. Because too often you're told to do that, put this thing on by your doctor or your family member, but if it doesn't give you benefit, doesn't make you feel good, if it makes you feel old and frail, you're going to stop using it as soon as they stop forcing you to. So if for wearables to have any effect, they need to be desirable. Just like we now all have iPhones, and honestly, Apple Watches are desirable too. That's probably why the Apple Watch is one of the best wearables out there in terms of efficacy, because people want to put it on. So wearables will play a big role, but we need to figure out how to get people to want to wear them, because we have the technology to get all this data from them. Now it's about how do we actually collect it.
Yeah, I agree with you, but I also would like to advocate a little bit about variables. For example, I know a very good case with Orarin, which is very popular for biohackers. It is for tracking your sleep and is extremely popular. And each biohacker just have this ring, and yeah, it's a good example of variables. So. It depends, yes. And by the way, I also know some cases when wearable devices help to collect more higher quality of benchmarks. So it's not the same that using usual devices which you can buy from shop or some phone, because with wearable devices you get a higher quality of benchmarks.
I would add my 2 cents here. There's a very good book, in my opinion, called Longevity Economy. And it's written by the head of MIT HealthTech Lab, Joseph Kuhn. And he actually addresses the issue of the HealthTech market, including the wearables, because there's a discrimination towards elderly people, because most of the devices makes you feel, frail, not cool. And actually, we have baby boomers who are entering, the elderly cohort, and they are, on average healthier, more educated, and they want to continue being cool, right? And then if you're wearing some, a giant button on your neck and you're supposed to press it, when you're starting to have a heart attack, there was a study done actually. And first of all, it was not a popular device to purchase. And then those who purchased it actually almost never used it. So I think bridging this gap in terms of, discrimination and profiling age group as a frail, cohort that needs lots of help needs to be addressed. So and I think COVID in some ways, in terms of, I can use, Adam used an example of his mom. My mom was not very tech savvy, but we live in different countries now. And she had to embrace lots of technology, which I don't think she would have unless she had to. So I think that the past few months, at least with respect to cool devices, let's say, will offer, will open more doors, just because out of necessity, many elderly people, had to use new technology. And actually, in case of my mom, she really enjoyed it. So she's a big user of TikTok and Facebook and everything. And she's more up to date on most things technology-wise than I am these days.
Nice. It's very good, and we just in time. So the time is over. The time for discussion is over, and now we will start our next section. And I'm happy to have such great speakers today. Thank you very much for being with us. Please stay with us. Now we will start next part, and you also can join Q&A session, because as I already mentioned, after each speech we will have Q&A session. So what now we finished discussion, and I would like to introduce our startups today. Biostrap, by the way, wearable device, Sana Health, Your Life RX, Sierra Medical, and FBB Biomed. So this is the order, and each entrepreneur will have up to 10 minutes for pitch and around 15 minutes for Q&A session. I suggest don't pitch longer than 8 minutes, and rather have more time for Q&A session. And I already said that great investors joined us today. And now I would like to introduce Irina Lanina, venture partner, VU Venture Partners, Jonathan Chang, Santarian Ventures, Nicholas, Dan Joy, Agricology Capital, Kishore Jinji, Astir Ventures, Scott Amix, Loyal VC and Amix Ventures, Jasper Bose, M Ventures, Asama Hassan Name, Rising Tide, Elliot Levy, Dream IT Ventures, Sanal Panda Tau Ventures, and Lubna Dajani, mentor at Source and Springboard Enterprises. So, Mick, please put all speakers together. I mean, put first entrepreneur main for first presentation, first startup.
So I just I already put Wesley there. So, but before we will start, I want to ask all presenting startups who will present. We are still missing a couple people. I put them in chat. Richard Henbury and Rick Biberman. If you can please put some message in chat so I can
they are
identify
going.
you.
Yeah, they are going to join us a little bit
And
later.
Wesley will be able to start, and while that, I will put more investors funds to main room, to main stage, so they will be able to ask questions. But guys, please put your names in right way, so I will identify you like easier because sometimes it's hard to identify people. Like Leslie, for example, it's have only she has only first name, and it's pretty hard. So please do your best to help us, and we can start.
Yeah, please start. First, startup Biostrap, and please start. Share your screen and pitch. Hello, Wesley.
Here I go. Here I go. I just want to make sure. Can you hear me okay as I start sharing here?
Yep.
Yeah,
Please
yeah.
put it on. Yep.
You bet. All right, great.
Yep.
Full screen. Here we go. Thank you
How
for
many minutes do Wesley have, Julia?
I'll
What?
take 10. I'll take
How
10.
many minutes Wesley have?
Yeah, I moderate timing, of course, sure. Start, please.
Okay, sounds good. I was very excited to hear the panel. And especially at Gunther, you were making points about the combination of biometric and biomarker data. And that's exactly how we're thinking of this platform that we're building here at Biostrap. I'm supporting them through Coherent Capital as part of the fundraising process through multiple rounds. And I'll be presenting here today, and Samir, the CEO, will be on afterward along with myself for questions. What we're building is a full stack all the way from hardware to software into the cloud, and a full platform for developing clinical grade algorithms and providing consumer insights to consumers, but also to enterprises around biometric and the biometric layer on top of productivity, burnout, stress, sleep, and a lot of the different biometrics you can measure through the skin and through other waveforms as well. So I'll get into that in the presentation. What we're looking at as far as opportunities are the current market status of a real lack of baseline health data, and thus actual actionable insights off of that baseline data. So majority of people are not tracking their health biometrics, anything from biomarkers to gut tests and blood tests and hormone panels. It's just not something that a lot of people do. Organizations, including large self-insured organizations, are increasingly challenged to lower their health costs and then also balance productivity with the level of burnout and the demands of the workforce. For clinicians, they're unable to get high fidelity tracking data when they're making interventions with a patient or with a client if they're a naturopath, for example. And then on the disease state side, we find it fascinating. There are no pre-insights around neurological conditions and even neurological acute events like concussions. But we're looking at ALS, Alzheimer's, and other long-term chronic and late-stage life conditions, and then grabbing pre-insights before they get to that point to start to develop IP around flattening the possibility of them developing severe symptoms. And what can be done in the future is really the question we keep asking. So the device itself is something that Biostrap has created, came out of the medical community actually, and it's turned into a consumer-facing product. This actually utilizes a red light sensor, which is one of the moats around it that we'll talk about. But with this red light, you can penetrate the skin several layers deeper than a green light, which is what most fitness trackers use. And thus, we actually have a lot deeper data and more raw PPG waveform data, which becomes very important when you're building algorithms and when you're looking for machine learning insights, especially as you start to port in other waveforms. When I say other waveforms, I'm talking about voice, I'm talking about movement, and proprioception is measured by the extremities. And Biostrap is able to do that as well. One thing that we're really tracking and tracking close to clinical grade is heart rate variability, and heart rate variability is correlated with a lot of the leading causes of death in the US. This is an early indicator of many different states, and what we're looking at is what can we start to learn over time about when to offer potential interventions on things that may happen. And overall, and I think going to Kate's point, I know you're really into longevity, but inflammation as a base layer, has a lot of impacts and could be really underlying a lot of the late stage disease states. We look at HRV as well and say, when can we start to offer interventions to avoid some of these things, or at least avoid severe symptoms of some of these? I find it very fascinating here. The next part is to overlay Alzheimer's risk with age when it's untreated and when it's treated. And what we're looking at, back to Gunther's point of movement data, is can you start to lower that untreated curve to the treated timeline by adding in a bunch of different waveform data? And gait is definitely one of those things, and it's something that we track very, very well, along with the typical wrist tracked biometric data. Overall mission is to empower a lifetime of human health insights, and what we offer through multiple devices are a really holistic view into what is going on in your physiology, a lot of powerful correlative data that will eventually turn into a really powerful AI recommendation engine to help flatten those curves and prevent onset of future disease state, or at least disease state symptoms. We look at this in waveforms, like I said. So we are measuring PPG waveform from the heart, one of the only wearables that does raw PPG waveform. You can pull a lot of biomarkers and biometrics out of this, including recovery levels, stress levels, blood oxygen levels, respiration rate, just to name a few. There's a lot more. We actually have 29 different features within the waveform that we're tracking, including secondary and tertiary. Movement data can be measured off of the wrists and off of the ankles, and we have a device for that as well that integrates into the platform. And then we can import third-party data like a voice waveform, which actually can track aspects of mood and concussions and neurological symptoms. So as you can see, or maybe see, what we're pointing to is creating a data warehouse of multiple data streams, and then looking for features and kind of joint venture features within those to come up with very new algorithms and IP. So we strongly believe that we'll be the first company to combine the typical really high grade biometric signals you can get from the wrist with other waveform data from either devices or importing voice data, and come up with proprietary algorithms, and that all connect and algorithms run through the cloud so that we can continually run analysis across a lifetime. Multiple studies have proven our clinical grade accuracy on the sleep side and on the HRV side. And the whole thing that we're building is to quickly and systematically deliver precision health insights. But what that really means is, can we quickly come up with new algorithms and insights that are actionable and offer them to the end user? Recently, we've seen a lot of demand for these solutions. This company has essentially been an R&D company that happens to sell to consumer for the last few years. But now we're actually pivoting to take the R&D to meet the market demand that's incoming. For example, within 8 weeks of COVID in the US, we launched into 7 different clinical trials to support either Mayo Clinic physician burnout, Tulane University, can we predict the onset of COVID with just the biometrics that we're tracking. This is very similar to a lot of the news that's coming out. All wearables are trying this. We just are really proud of the fact that we can support this many trials, and that we're the biometric layer add-on to other trials that are going on right now. Really excited about neurological condition tracking and disease state tracking, as I pointed out, where we don't really think anybody is doing this within the biometric tracking market. When you combine wrist, sleep, recovery, stress, and movement, along with other things like voice, like I mentioned. And we have a lot of proof points in the ultra high performance market, from SWAT teams to fire departments to Olympic athletes and other elite athletes across different sports. Really excited about this as well. We are typically compared to other consumer devices, but internally we really focus on what is the stack of solutions that we offer that no one else is doing right now, and that maybe can't even go into in the future. As I mentioned, raw PPG waveform, excellent at that. All the way down, tracking all these different biometrics in the top half, including actionable insights, the ability to do on-demand biometric recording to see what's happening in your body right now. Very unique. Step tracking, Now we move down into organizational features, which is where we're really focused, which is building out both white label and Biostrap branded solutions into large organizations like studies or even like corporate organizations, or where we see a lot of demand is in practices like clinicians, naturopathic doctors, physical therapists, dentists, even building biometrics into their workflow to offer more value to their end customer. So to that end, we have an SDK API, only wants to do that, and a lot of anonymized insights so that the patient is able to manage their health, but is not necessarily sharing private data back to anyone in particular. I'll spend a second on this because I think it's very important. A lot of other wearable competitors have really great systems and even driven insights from the data, but it's limited to a single form factor. What we're really excited about is that we connect with other devices and connect with them quickly. And we have our own multiple devices, all to be able to come up with new AI and ML insights. And we're building the machine learning insights off of a raw waveform that no one else has, meaning we have just deeper data and we have more insights off that data, and we're going to be adding layers on top of it to come up with features in the data set. Really excited about the growth trajectories coming in from the beginning of this year. We've been selling a baseline direct to consumer for about 4 years, and now are shifting to support really large bulk orders and organizations, and are projecting a quadrupling of monthly revenue by the end of next year. And we proved this in the last 8 weeks just by launching into different trials, and incoming demand has tripled and quadrupled, I believe. Really great partnerships on the research side with NIH, Children's Hospital of Los Angeles. Like I said, we're studying physicians at the Mayo Clinic. And I'll point you down to the fitness row as well. The National Academy of Sports Medicine has highlighted us 4 times in the last month on webinars, working with top Olympic athletes to train around their recovery and come up with new regimens based on that. I'll go over some really high-level opportunities. Huge market for just creating new algorithms for condition tracking and pre-condition tracking. Remote biometrics for clinical trials is where we're getting a lot of demand right now as well. And then creating an overall biometric platform to offer precision medicine, whether that's to the consumer or through an organization or through your doctor. We really are excited about combining multiple waveforms to make precision medicine a reality. Crossing the 5 major areas of healthcare IT, big data, AI, mHealth, wearables, and cloud computing. And I'll show you some of the abilities now within the platform, able to give population level insights, dig into a user's particular baseline and up and down what's happening in their life. Able to show a burnout risk for an organization, for example, a sales or engineering organization, without showing any specific data on an individual user. This can be offered to an organization to make sure that they're actually recovering and performing at a peak level as a group. I'll go quickly through some of our technical abilities, all based on the fact that we do multi-devices and have a cloud platform. All of that is built. Now we just deploy applications for this rapidly. The sleep lab is able to recreate near sleep lab settings that you'd get from having EEG and sleeping in a lab overnight, all through pulling in your sleep cycles, your respiration rate, SpO2, using that raw PPG, and tracking your movement off of the ankle, and even snoring via your microphone. This is an example of an in-depth clinician report that you could run for yourself even to just see some technical data on what's going on in your HRV frequencies, your arterial elasticity and peripheral elasticity, which is a sign of your arterial network's health and your blood flow. Again, all of this is coming from the wrist. This just is a case study from the University of Utah that shows how closely we track and the agreement between SpO2 and HRV changes when tracked against other gold level devices. And then clinical validation coming on the PPG versus ECG. It just matches so perfectly. This is using the Biostrap and matching it with the ECG. Brain health. I mentioned the importing of voice analytics. Really excited about this as a futuristic solution, combining it with current biometric data. Samir and Dilip are the co-founders of this company. Previous exits and successes really great team on the medical side. I'll highlight Kevin Longoria, who's been training Olympic athletes for the last 5 years, and the lead data scientist, Rainier von Mark. What we're looking for right now is first outside capital from a strategic investor, probably a limited amount, less than 3 or 4 investors, hopefully, that are excited about this space, have a vision for this space, and can help us service these large client orders and interests that are incoming, are excited about the possibility of creating new algorithms and patents around gait especially, and neurological condition tracking, and then allowing us to build new features to quickly support this incoming new revenue, such as remote clinical trials and B2B2C opportunities, and then really building a powerful AI engine that can offer insights really quickly based on what's going on just hour by hour or day by day and overnight. So I'll go ahead and stop there and open it up for questions. And I believe I'll have Samir on for questions as well, who's the CEO of Biostrap.
Mm-hmm. Yeah, good. Thank you, Wesley. Please stop sharing your screen.
Sure
And yeah, Mick, please put all our investors together.
Okay. Thank you.
Mick, please put all the investors together.
Yep, everyone just start to turn their cameras and it will be together.
Yeah, yes. So
Guys, please put your cameras.
nice to meet you all together. And no, so not all investors. Oh, yeah, more investors. Good, good.
Wesley, is Samir Sontaki?
Yep.
Okay, good.
Okay. So, dear investor, do you have any questions to this first entrepreneur who just presented Biostrap?
I actually do. Hi, thanks.
Yeah, please, General.
Do all of your hardware, the accessories from the HRM monitors to your wristbands, etc., do they all pick up the PPG? Or is it just one of your products right now that can read the PPG?
The PPG comes from our wristband primarily. The heart rate monitors are just using, we're just using RR intervals to calculate HRV and heart rate.
Hi, this is Scott Amix speaking. I was actually very much deep into this space about 5-6 years ago, and this was a very hyper competitive space. I'm glad to see that it's moved over to more of the medical grade. In terms of the sensors, things have kind of become somewhat commercialized. You got providers like Valencell, Cellotron, Pulson, Cardio,
yep.
Many others, right? Healthify Me, right? Even our friends Peter Lee at Atlas. So they're working on a lot of different things. So at the end of the day, the sensors become somewhat commoditized. It's really about signal processing. So can you speak to a little bit more about your precision and fidelity around signal processing and how you guys are combining that with ML capabilities?
I love that question so much because that's exactly what makes us different. They've commoditized it. We went to the Maxims, Ostroms of the world, and what they've done is commoditize it into the chip. Essentially, their business model is to produce SpO2, all these different algorithms in the chip, and then keep adding new features over and over. In a way, I've built something that's, in a way, kind of future-proof. And why I mean that is that because what we're looking at is high SNR, high resolution data. We're looking at second derivative waveform features, which allows us to look at things like what Wes was talking about, the endothelial function, more around the arterial peripheral elasticity, ejection fraction. These are things that are all in the algorithm signal processing side of things, which we have just done a phenomenal job in the last 5 years. And a lot of our IP is around how do we clean up that waveform data with the highest resolution data that's collected on the wrist. So the signals produced by Maxims, Valencells, it's really maybe to get that just minimum data sets required to maybe show you heart rate. But really, we're not even interested in SpO2 heart rate. It's like, how do we extract even more biometrics out of it? We're working with a partner that I can't really name. They're inventing a new biomarker that's looking at the modularity of vasodilation that's never been kind of created before and is used for children and to assess pain. This can only be done, people come to us for raw waveform because you can't really get it. But it's one of the unique features that we started off with. And we believe in PPG so much that there's so much to be extracted in that rich waveform sets that people are not really realizing. I hope that answered the question.
Super, thank you.
Yeah.
Mm-hmm. Thank you. Any more questions?
Yeah, I have a question. It's Jasper Bos. I'm the Managing Director of M Ventures, the corporate fund of Merck. You're talking about a very sizable clinical trial market, and we all know that it's a very conservative market and very much regulatory driven. So can you speak a little bit about how you wish to actually address that market?
Like the remote clinical trial market, correct? Yeah, so we've been approached by those markets. Usually because we're not FDA approved yet, though that is on our trajectory, given that we've actually made the decision to move more enterprise medical recently, we become kind of the secondary endpoints of a primary device is really what comes down to it. So we can be included in remote clinical trials. But that is to say, some people, don't, it's up to the payers to see what devices they can use for remote clinical trials. We've identified that as a very good market, and it's the main driver for why we want to get the FDA approval so that we can get on the list of devices approved. But remote clinical trial is becoming a very big deal. It always has been, but now it's even bigger market for us that we've never really looked into. So it's one that I'm pretty excited to get. But it does, the FDA clearance and all that does help us a lot. But we haven't seen it as a gating feature too much, surprisingly.
Okay, thank you very much. If you don't have questions or more, we are going to start the next presentation.
I'm just curious, one thing. Do you do any of your AI is all in the cloud, or?
It's like having a cloud wearable, essentially. Everything's done in the cloud. All the kind of filtering is done at the wrist level and the app level, but the cloud is really all of our IP is in that cloud processing. And all the algorithms, we keep rapidly developing in the cloud, essentially, for new algorithms.
Right. So you have to have connectivity all the time.
Yes.
And from a user, from a data subject perspective, what is the experience exactly? Is it, do you get to just, I guess you're just wearing it. How do you engage with it?
Yeah, it's and I'm actually not even wearing it because it's charging the charger right now. Otherwise, I'm always wearing it. But it's a device you just wear. Oh, yeah, there it is. Wes is wearing one.
How long does the charge last?
About 2 to 3 days, and that's just a function of the hardware. We're certainly not hardware experts. We're software experts, but we built essentially enough hardware that we can do everything. We can control every single sensor, frequency, sampling rate. You can't do that with the Garmin SB, Fitbit, any of those things. We can create custom solutions, and we have for enterprise, saying I want to sample at this frequency, or clinical trials, I want to sample at this frequency, this duty cycle. Everyone has specific requirements. We have all the tools to do it, and doesn't even require effort on our side because that's just our expertise. But having that much granular control has been a very good strength of ours because people that want to collect data at certain times and frequencies, we can cater to those. We have a general user experience too, for consumers, but we can go into specific type of use cases based on the needs of the organization.
I have a quick question as well. Do you work with your device and system as well on integration for any patient medical records?
Not yet. I think it's definitely an area. Again, we made this decision to go into kind of medical fairly recently, maybe about 6 months ago. So our kind of timeline has shifted a little bit in terms of what we want to do. I think that is a good area to explore.
And one of the, I'll mention, Samir, I do partnerships for Biostrap, so very familiar with where we're going strategically. And that's one of the partnerships we actually have right now that we're forming is with different organizations that can port this data into patient medical records in a HIPAA compliant way.
Exactly.
And it's all architected to do that anyway. We just need another organization to kind of play the buffer in between us and medical system.
Okay, thanks.
Thank you very much. Dear investors, do you have any more questions? Please. Oh,
I do have a question on the customer side. So you mentioned that you've already deployed with a number of patients over the last couple of months. How did you get to those patients, and are they of any specific target market, or just curious as to how did you get the ball rolling on that?
So we started as a consumer device. Most of our first 10,000 users were all just Facebook ads, Google advertisements, using a very complicated system that was maybe a little bit harder to use at first. And we've now, in the last 6 months, targeted to different segments. So the way, we don't have patients per se, really. Some of them are. It depends on which, we're in the pain clinics, we're in the sleep industry for people's devices that treat sleep apnea. We're in the addiction space as well, so those are patients as well. We're in the athletic market, and what we become is kind of the biometric layer that essentially becomes decision making for certain verticals. So let's go into like the addiction market, for example. These are rehab centers that are essentially motivated for the outcomes of the patients, right? So they are looking at biometric data to see their trends analysis and feeding into their own AI engine. But they're using biometric PPG data as a kind of decision making, and also location tracking. They have their own logic, but it is the biometric data that becomes a core part of their offering in their platform. And we love those kind of partners.
Thank you very much. I think the time is over for this startup. And now please, Mika, show us questions for investors. Please, investors, just choose one of their answers here. This results will not be seen to anybody, so just answer for us so we can understand how do you like this startup.
And we have 20 more people to vote. Well, okay, fine. I guess we have the results as for now, we see it. Okay, good. Thank you.
Okay, so let's invite the second startup, Sana Health. Who is going to present Sana Health? Please remind me. There was two. Sana Health.
Hi, everyone. Thank you for your time, and it was a great pleasure listening to the very high quality of questions. Definitely advantage of a niche group looking at biohacking. What we're here to talk about is, for us, the future of chronic pain relief. And our mission is to deliver freedom from chronic pain. Now, pain is a fundamental amalgam of both the initial acute pain plus then how the brain processes that pain. Now, I learned about all this area because age 19, I was driving down a road in the Yemen. I was forced to drive my Jeep off a bridge in order to avoid a head-on collision with a petrol truck. My Jeep went down 60 foot into a dry riverbed, crunched up like a Coke can. That gave me a spinal injury from T8 to T10, so belly button level, torn aorta, clinically dead for 8 minutes, coma, out of a coma. And all of that resulted in a nerve damage pain problem that was so severe I was given a 5-year life expectancy. The standard of care then is still the standard of care that exists now. It starts with opioids, goes on to gabapentin and other drugs, then internal devices, external devices. And for a very large number of people with neuropathic pain, when all of that fails, they go on to try to teach meditation. Now it would be called mindfulness-based stress relief, but it's basically the same thing as back then. Because of that entire process, I realized that, okay, I'm trying to learn to meditate, and the electrical storm in my head is at a 20 level, and I'm trying to hold a candle within that storm with me trying to meditate. And that made no sense to me. So I was like, okay, well, how do I find a way to hack the ability I would have if I'd already meditated for 20 years? So I dug into all the research on long-term changes to brainwave patterns because of meditation. And then I built a device that uses pulsed light and pulsed sound in order to trigger those effects in the brain that you have with long-term meditation. I'll come on to that mechanism in a bit again. I think all of you are aware of how big the pain market is and the pain problem is. Drugs essentially don't work longer term because they're not actually killing pain. They are stopping your brain's conscious awareness of it. So you can use opioids to basically snow you out so you're unaware of how much pain your body stays in, but that doesn't change your life expectancy if you've got a very severe pain problem. Chronic pain is made up of 4 major compounding comorbidities that all feed into each other: pain, sleep, anxiety, and depression. And in many areas of chronic pain, people will end up taking individual drugs on each of those areas. We built a technology that will actually address all of those areas, and we're going through clinical trials in each area to prove that. We are data-driven. Thank you for all the discussions on HRV. That makes my life easier. We're collecting heart rate variability data off the forehead, and then we're matching that with subjective data before and after every use of the device. So we're getting a very tight amalgam of objective data bounded by subjective data on pain, mood, and sleep. We have 6 large clinical trials this year. Mount Sinai has already started on neuropathic pain. NATO is with Canadian and Hungarian and US Special Forces on sleep and fatigue mitigation. Duke is starting next week, and that's on fibromyalgia. Anthem is lower back pain. Cleveland Clinic is multiple sclerosis pain. And Aurora Mental Health Center is on treatment-resistant depression. So why can you do something with audiovisual neuromodulation that you can't do with other modalities? Well, it turns out that the very big difference between what happens in someone with chronic pain compared to acute and chronic anxiety compared to acute is you end up with a very big disparity between the left and right hemispheres of the brain. And this is what I discovered when I first started comparing my brain patterns to those of long-term meditators. Long-term meditators end up with a very good symmetrical balance of left and right hemisphere activity. I had a very different one, a very big difference between left and right hand side of the brain. So the picture on the left is basically someone with severe pain, and mine looked very much like this. This ends up being a signature pattern for most people in chronic pain and most people with chronic anxiety. And over time, the audio-visual neuromodulation of the device will get someone's pain level, someone's hemispheric balance back to a normal homeostasis that then allows a deep relaxation effect. Clinical trials, early clinical trials, we're averaging a 45% reduction in anxiety, 20–40% reduction in pain, depending on the type of pain, 49% depression reduction. The most important trial we've done to date has been on fibromyalgia. Now, fibromyalgia affects 10 million Americans, 80+% women. It's a massively underserved market. The biggest selling drug is Lyrica, that last 2018 sold $4.8 billion worth, and fibromyalgia makes up the bulk of that. We got 3 times the efficacy of Lyrica with 0 side effects. And as a comment, the side effects are so bad on Lyrica that even though it is the first drug tried and almost everyone tries it, only 20% of people will end up taking it. In that trial, we got 90% still using the device at the last 9-month follow-up. So essentially, everyone who used it after the first 2 weeks was still using it at 9 months, and a 30% drop in medications across the board. Again, I mean, I can come back to the market sizing on pain, but I think everyone gets it's a huge market, and fibromyalgia is a good section of that. COVID is obviously increasing the need for at-home health devices. There's plenty of data currently being produced on why telehealth is massively ramping up. It's even more the case within the chronic pain area. Fibromyalgia is a very good example of the compounding comorbidities, and people currently having to take individual drugs for each individual comorbidity when none of the drugs have ever been tested for efficacy or safety in combination with any of the other drugs. As a contrast to that, a simple device that is actually tackling some of the underlying issues has so far proven more effective, and we've got the largest studies underway to confirm that. The market size on that, it's 10 million people that have been diagnosed already on fibromyalgia, and we're talking about an 18-month subscription at $100 a month. And then that's the start of building a platform. These are the other trials that we've got going on this year, most of which I've talked about already, but it covers all the main comorbidities, so sleep, pain, anxiety, and depression. We've got strong IP. Our first patent was published in June last year, and we have a portfolio based on the same prior art that has already been accepted, with some broadening of that prior art. Basically, it covers any use of rhythmic light or sound, or the combination within our target areas. Team, I've been working on this 28 years now total, full-time since 2015, where the advances in HRV sensors meant that I could build a standalone device. Tasha, my COO, 20 years of medtech experience, so I can come back to the team on that. Within fibro, if we get to 2% of the fibro market, we're at 100 million ARR. And bear in mind again that Lyrica has 20% of the market, and we're 3 times as effective with 0 negative side effects. Since funding, we've had $11 million in funding. Since inception, we've had $11 million of funding so far. This current raise is on 4 million. Now, the use of that proceeds, we've raised the first sort of half of this round as a 4 million safe note, and now we're raising the 5 million equity on top, of which we've got 3 soft circled, which we will hopefully be doing an early close on soon. But that is to get us to a point of going through the largest study on fibromyalgia, so that first FDA approval, and early marketing launches. So we have already launched as a wellness device on a very soft launch, and then we will relaunch again on as a medical device on fibromyalgia to start with, and then the other pain and mental health indications. So thank you for your time, and over to questions.
Thank you, Richard. So thank you. Let's switch to questions.
So Richard, this is Scott Amix. I have to say I'm a big fan. I think you guys gone through SOSV's HEX accelerator program, right?
We did.
And you're one of the few entrepreneurs that have really spent decades on this very difficult challenge. I have a comment and I guess a question as well is, you know, as you look at kind of clinical evidence, and there's a lot that's going on, pain management, mental health, recovery applications, how do you start to focus, right, in terms of the various different kind of holes they can get into on the clinical side? And the bigger question that I really have for you is, you are endangering pharmaceutical cash flow. So how is that being perceived in the marketplace?
Okay, so on the first focus point, one of the things we're trying to do still is it's a balance between focus and mitigation of risk. So fibromyalgia is an area where we've got both really good direct-to-consumer opportunities and reimbursement opportunities over time. There are other pain indications that really do need to fall into the reimbursement bucket, and therefore you are at the mercy of other people in that reimbursement process. So we chose fibromyalgia to start off with because there's such a dearth of any real solutions that it has the flexibility of having that direct consumer first while we're working on the reimbursement side. We have had very in-depth discussions already with Anthem and Harbour Pilgrim, so we have a plan for that, and we have an expected timescale, but we're mitigating that risk by allowing ourselves to go direct consumer in the meantime. On the cash flow point, it's a very good point. On the opioid side, opioids have got enough problems without us, and the sort of federal level of trying to lower the amount of opioids being taken through legislation and other methods. It means that people are needing to find alternatives. So it's not really coming down to us as a problem on that side. We've actually had more discussions with pharma about drug-device combinations than we have had discussions around how we could be damaging some areas. So Ambien is an example where I don't believe Ambien adds anything to the mix of things that people can use that we can't do a lot better on. But there are other drugs where we can be a very good companion to them. For example, Novartis has a drug called Piqray, which is for breast cancer treatment. And the most major side effect, which trashes their compliance, is anxiety. And so with that kind of combination, we've been having early discussions with them about, okay, could we do a drug-device combination so that we can lower anxiety and someone's compliance on that drug goes up? So we've kind of had that mix of those discussions. We've also had, even in the last couple of weeks, actually, 2 different psychedelic pharma companies come to us and say, could we do a drug-device combo with them in clinical trials? Because psychedelic pharma has a very good, large increase in neuroplasticity in a short amount of time window, and we can potentially work together with them to extend that time window of increased neuroplasticity. So I think it's a mixed bag. There'll be some areas where we have great collaborations, and there'll be some areas where we will be seen as a direct threat.
Yeah, I agree with the combination approach, and certainly for some of the pharmaceuticals that's dealing with negative PR on opioids, to be able to actually reduce their pharmaceutical baseline and combine with yours makes it very effective and a tremendous storytelling.
Thank you very much. Appreciate it.
Richard, thanks a lot for a great presentation. Can you tell us a little bit about the ideas around differential pricing of a consumer product versus a regulated medical device? Because is this going to make use of different algorithms? Is there any differentiation between it? And how are you dealing with a consumer price versus the quite often much higher price for a regulated prescription device?
Yeah, very good questions. Currently, we are making those trade-offs in favor of the reimbursement pricing. So we're currently using the price that we want to get for reimbursement as our consumer price, which we don't want to do longer term. We were advised very strongly to do that until we have reimbursement, and then to create the differentiated devices. The very main the most important differentiation between those two will actually be on the back end. So the medical version will integrate with EHRs, it'll have physician dashboarding, it'll enable the integration of the device into the continuum of care from the provider side. That's really the largest difference between what will be the largest difference between the two versions. There'll be cosmetic versions as well, the cosmetic differences as well, but that's the core of it. We are in the process of planning a military version as well, because of military interest we've had across fatigue mitigation and also PTSD. There are some firmware differences that they will require based on special forces, for example, not being able to have access to telephones when they're on duty, things like that. So there'll be modular differences to the firmware between different areas.
Thank you, Richard, and thank you, Jasper and Scott, for your questions. Dear investors, do you have any more questions?
I have a question about, maybe I've got a question about the installed base, and if you did already some, I would say, back testing on the people using the device right now outside the trial, and how long they use it, and how often they use it, and do they use it really without any additional medication or not, and what kind of pattern do you see there? I have a second question on the production cost and the selling cost, and that's basically about it.
Yeah, certainly. So the fibromyalgia study and the aftermath of that is where we've got the longest data so far, which is now 9 months. We've had, so from the end of the trial, we've had 9 months now since the end of the trial. And everyone who chose to use a device at the end of the trial, which was 90% of the people who started the trial, are still now using, at least on a daily basis, 9 months later. During the trial, or the beginning of the trial, the usage was an average 5 times a day. We told people they had to use it twice, and then PRN for whenever any of the symptoms were too much. So fatigue, pain, sleep depression, if any of those were out of whack, then to use the device. So they got to a sort of maintenance level over the course of that 9 months. And on average, they were using once a day afterwards. We've now had some people come off the neuropathic pain study at Mount Sinai, and small numbers, but the very first person who bought one of the devices off the website on our very soft launch, before we'd actually told anybody that it was there, were 2 of the people that had rolled off the Mount Sinai study. But short numbers on that. Does that, sorry, first of all, does that answer the question on the long-term usage?
Yes, and pretty much. And do they still use additional medicine or not during the treatment?
Oh yes. So overall, we've had about a 30 to 50% drop across all meds. Around about 30% on all painkillers. What tends to happen with fibromyalgia is once you improve quality of life, pain levels actually temporarily go up because people do a lot more. So they're then taking more NSAIDs, and we saw a shift from opioids to NSAIDs as well within that 30%. People just taking less strong painkillers. The trade-off between painkiller usage and device usage that someone's making in real time is basically how aware of my surroundings do I want to be right now. So if people want the maximum painkilling effect they can have, they will take an opioid. If they want to spend time with their family or work or drive, then they will use a device and then shift more towards NSAIDs. So people tend to be using it as a tool within the toolbox to improve their control over their life. On the anxiety meds, we had a much sharper drop-off. Actually, even though we told people in the trial not to change their meds, we had one person quit their Xanax cold turkey on day 1. But overall, we saw a much sharper drop-off over time. Lyrica was another one where there was a big drop-off. Again, that's largely because I think of the side effect profile being bad enough that people are like, okay, the soonest I can stop taking this, I'll stop taking it. There's early days. The Duke study is 1 month of efficacy and followed by 6 months of detailed health utilization afterwards. So we'll have a much higher quality data feedback on medication usage from the Duke study than we currently have from the smaller study. But it's definitely high up on the priority list, because in terms of reducing healthcare utilization, the pharmacy cost is obviously immediate and compelling. And then the second layer after that is visits, scans, all those other things that go into that second bucket of health utilization. And ideally, we want to be able to show payers that we're getting a very strong drop in both direct pharmacy costs and overall health utilization. And I think we'll get both of those. Does that answer that question?
Yeah, perfect. Thank you very much.
On the cost side, our current cost of goods is around about $350 per device. And the next generation device that we're already designing will be down to 75. Essentially, the current device that we are producing skipped the DFM stage. We had a working prototype that then we had to produce in larger batch sizes for clinical trials, and we didn't want to slow down in clinical trials in order to do the DFM first. So we made the choice to go too early into that early production whilst we were redesigning from what we knew we wanted to design. The only real technological change between the two is actually the redesigning of the sensors, and we're working with Linear Dimensions on the improvement of the HRV sensor to be a laser-based sensor, which gives us it will give us up to 14 millimeters away from the head that it can be, and still get a very good signal. And that gives us a lot more flexibility within the engineering of the device to be more comfortable, to fit more head sizes, and also to deal with different skin tone and skin color, because the laser-based system is compensating for that in real time. It's working out which frequencies are getting a better signal and then locking on those frequencies. So that's the major difference in the upgrade. But the cost differential, we are targeting a $75 COGS on the next version. Okay,
thank you, Richard. Thank you. Your startup looks very promising, and thanks for all these answers. I think that time is over. And Mick, please show us questions for investors and for guests as well, because as we know, among our guests also some investors. Mick, please tell us when you have results.
Yeah, it's going. So almost half of you guys voted. So we are waiting for another half.
Yeah, but you just can mark low investment interest, medium investment interest, or high investment interest. It's up to you. It will not be seen by anyone.
And meanwhile, we have our next startup, who will be?
Our next startup will be Your Life RX, and I see Baruch already ready to start the presentation. So just waiting for your.
Okay. Yeah.
Yeah, that's it.
Yep.
Okay, do you see my screen?
Yeah, we see your screen. Very good. Yeah.
Okay. My name is Brooke Halpern. I'm the co-founder of Your Life RX. I, along with my partner, Phil Keogh, who's also on this call, are building the personalized digital apothecary. Our goal is to disrupt the way that health is managed today. I am here to tell you how and why. Before I tell you about myself, let me tell you about my partner, Phil. Phil is one of the most accomplished executives in the pharmacy business, having run over 10,000 CVS and Rite Aid locations over the course of his career. He also ran Millennium, a long-term healthcare company. More recently, he was president of pharmacy operation of Sears Holdings. Phil is a great asset in navigating the over $400 billion, highly regulated healthcare business. Now, let me tell you about myself and the experiences that have made me who I am today. I started life as an accountant. At 24, when I received my MBA, I started working as a business analyst for a major chemical company, evaluating the economics of multi-$100-million chemical plant expansions. At 26, I was asked to run the accounting, credit, trade department for a $550 million division of Celanese Corporation. At 28, I was promoted to director of the Celanese $250 million pension fund. At 30, I went to Wall Street, joining Fred Alger and Company, an aggressive equity firm. 5 years later, I decided to go on my own, and that is where Halpern Capital began. Our focus was on quality equity research and banking. We raised over $900 million in capital for public companies. Our clients were primarily hedge funds and private equity firms. We also completed several leveraged buyout deals with known firms such as Bain and Bear Stearns. To summarize, I am basically a capital markets guy. However, I define myself as an analyst who loves to solve problems. So why am I here talking to you about a next generation healthcare company? Here's where my story begins. 30 years ago, I was diagnosed with Crohn's disease. It is a life-threatening chronic condition. I consulted many GI doctors, but ultimately decided to explore what was best for me. I concluded that Crohn's is really an intolerance. I am now Crohn's free. I accomplished this myself through diet and nutraceuticals. Doctors who test me are always amazed at my health, but never want to understand my approach. I believe that we can all control our own destiny. And I believe that if we are to adopt diets and take nutraceuticals to improve our overall health, we might as well scientifically understand what our body is asking for. Therefore, I co-founded Your Life RX, and I personally advanced the first $2.5 million because I wanted to build a platform that simplifies the health journey we are all that I was confronted with. Our vision is to build the digital apothecary that consumers always wanted. We call it an apothecary because it has been around 100 years. In the old days, apothecaries made medicine and provided solutions. Today, we are a digital apothecary, available 24/7 that uses science and AI to evaluate the consumer's need and provide personal solutions tailored to him. Our vision includes 5 components. One is genomics, to help us understand the underlying biology. 2, a plain action plan that summarizes the conditions, medication, nutraceuticals, lifestyle suggestions, and so on. We sell through an apothecary because pharmacists understand your biology, your medicine, the drug and nutraceutical interaction, nutrition depletion, and quite frankly, 2 out of 3 people still consider the pharmacist to be part of their healthcare team. We use wellness champions to coordinate your care. And finally, we offer only the best, carefully curated products. It's not about the number of products, but it's about having the right products and the right solutions. So the monster problem that obviously we're trying to solve is people are generally unhealthy, high level obesity. 75% of patients do not take their medications. There's a lot of confusion. 86% of people take vitamins and supplements without any real professional guidance. And there's a lot of siloed solutions out there, but they don't look at the body holistically. And there are a lot of ancestry genomic tests, as you know, but they have a high error rate. So our solution is really quite simple. It's a platform that we offer online, in person. We call those healthcare innovation centers, and we offer it through a mobile app. And we have 4 modules. One is to coordinate care, and that's through the health champions and through telehealth. We personalize care doing genomic testing and other testing and come up with a plan for you. And we provide you with carefully curated solutions, hopefully once a month, easy dose pack. It's like the pill pack. And finally, you can't really get people healthy without monitoring adherence. It's really called nudging. Make sure they do what they're supposed to do. We have a secret sauce, we call it, it's nutrigenomics. We make genomic data actionable. We do it today. I'll tell you later. We've done 3,000 of these tests and so on. And more interestingly, we have proprietary products that deal with the specific mutation. We in fact have one patent product that deals with 40% of the population's mutation that's been common. And we have 100+ online courses for providers to teach them about genomics. And providers are not that knowledgeable about genomics and the relationship between genes and so on. So, and we also do now live and online meetings with the medical community. So how do we go to market? Well, we go direct to consumer, and we drive people to our e-commerce platform. We make our healthcare innovation centers available. We did buy a business about a year ago. We do have a one center right now. We plan to build 5, and we plan to license others. By the way, there are 22,000 independent pharmacies that would love to have our technology in the front of the store. We make it available to healthcare system providers. But basically, we drive the customers to that platform through advertising, digital marketing. I think there's a lot of opportunity, and we're already talking to people in terms of partnerships. And finally, once we prove some of the outcomes, we feel we could really capture insurers, self-insured corporation, and so on. We have an infrastructure in place. We're actually a $12 million platform today. We purchased a 100-year-old apothecary facility last year. We have an East and West Coast nationally accredited compounding pharmacy. We're licensed in 50 states. We have a nutraceutical shopping mall. We have clinical experience. We've done 3,000 genomic tests over 6 years. We have 100+ genomic online courses, as I mentioned before. We have proprietary products, and we actually lucked out, but we are actually the preferred pharmacy for CVS in terms of compounding. And now we just received a contract a few months ago. It was actually supposed to start, but with COVID, it was pushed to early September. But we have an exclusive compounding contract with a national retailer with 90 million members. So that is a huge, huge contract expected to start shortly. So we're looking for funding, looking for $20 million. It'll be used to build our management team. 17% of it will be used to build our technology, 28% for the infrastructure, acquisition costs, and so on. My apology. We have a business. Our business model calls for us to generate $425 million in revenue by 2025. 59% of that business comes from personalized healthcare. 34% will come from our compounding sector, and 7% will come from other products and services. We have a team, I've mentioned that before. We have Deb Hubers, who's our Chief Innovation Officer. She developed the Epigenetic RX as the founder, and she's chair at Bastyr University. So it is a competitive field. Obviously, there's a lot of siloed players and a lot of different players. If you look at this chart, lower left corner is the pharmacies. There's Walgreens, CVS, and now there's some of the new models, Alto, Keeps, Hims, Hers, and so on. But that's a $303 billion market. On the lower right, there's digital health management companies. That's about a $14 billion market. The upper right, you have your nutraceutical company like Vitamin Shop, GNC, and some of the newer models like Care of and 100. And then you have the ancestry companies, the genomic companies. That's about a $17 billion market. The difference is that we really take parts of all because we're really trying to provide solutions. So we start with testing and we go all the way to delivering the products that you need. So I think we cross over into all these categories, but only in a very straightforward, dedicated way. So to conclude, we plan to disrupt an old giant business. Basically a $400 billion business. We leverage the pharmacy trust model because 2 of 3 consumers consider the pharmacist as part of their healthcare team. So we don't have to really train them on where to go for overall wellness help. We use wellness champions because customers need help with their health journey. It's a little confusing, and wellness champion really reduces the churn rate. We focus on the whole body, offering integrated solutions including RX and nutraceutical and lifestyle changes. We use medical grade testing, we use proprietary and patented solutions. And finally, we have a fulfillment platform. So we make this whole delivery of the solutions that our customers need really simple. Thank you very much.
Thank you, Baruch. Thank you very much. Now time for questions. Personally, I think the startup is very promising, and we also got very good feedback from our advisors, from our main advisors, from our team. And yeah, do you have any questions? Please be active. Jonathan, I see you would like to ask. Yeah.
Can you talk about some of the proprietary and patented processes that you touched upon, and where you are in those stages, and what kind of barriers you have around that?
You mean in the proprietary and patent products? Is that what you asked about?
Or the processes you had mentioned that, or perhaps I heard you wrong, but
okay. Well, we have a nutrigenomic test. I'm not going to answer this really well. My partner on that side was not able to come today, but we have a nutrigenomic test, and we have 11 proprietary products. We have 1 patented product that deals with the MTHFR gene. So these are products developed to deal with the direct gene mutation.
Mm-hmm. Elliot, would you like to ask questions?
Hi, Berg. This is Scott Amix. I have a couple of questions for you. One is, I wasn't sure if I got the information accurately. Can you go over again in terms of where you are in terms of sales and path to break even? And my second question was, and again, I may have missed it, if you could just elaborate a little bit on your core assets that supports your defensibility.
Right. Okay. So, I mean, we basically have a $12 million business. We have a $5 million compounding business that, you know, is a pretty high margin business today. We do quite a bit in nutritional products and nutraceutical. We have a broad range. We bought a store a year ago that was an $8 million business, and as part of the acquisition, we're getting the epigenetic capability, and we're getting another compounding lab. We do have a contract, as you know, with a huge national retailer that's soon to start. So we have all the core capabilities in place. We've done a lot of testing, so we have all that. So we don't have to develop anything to really launch our what I call our sort of main product, which is the personalized care product.
Elliot, you wanted to ask questions?
Yeah, absolutely. Elliot from Dream It here. Thanks. Just wondering, so how sort of sticky is the user experience kind of to date? How long do you anticipate consumers being on the platform? And then as you're expanding into payers, are you sort of, you know, is the plan to kind of track some of the outcomes and the change in patient quality?
Okay, I'll let my partner Phil Keogh, if he could open his mute, talk about the outcomes and how that will work. And Phil?
Is he one of the panelists?
He was supposed to be a part of this team, and if you can, please make live.
Sure, what is his name?
Phil Keogh. But just to start, I think you asked first about the break even. Was that your first question? I apologize.
My first question was actually just about sort of engagement and how long consumers on average are going to kind of stay with the experience and where you see the drop off point.
Yeah, so I mean, we built in the model like a 15% churn rate, right? But we hope to keep the consumers engaged because we are delivering sort of monthly product. We're making it very, very simple for them. And we're using a Wellness Champion. I look at the Wellness Champion as a salesperson, nudge kind of person, someone makes sure they sort of stay on plan, probably not so different than Livongo does with diabetes and so on. So I think, you know, I think we built in the 15% of the prior cumulative customer churn rate. So we built a pretty good churn rate on that. In terms of, are you getting Phil on? Obviously, we're you know, part of a very important part of the whole capital raise is to build the systems to monitor results. Obviously, we fully expect to get results in a very positive way and get those outcomes. We have a fourth partner. We just didn't put him up there yet, but he is a technology guy who's built major consumer platforms. So we, of course, expect to use him in a large way to do the digital marketing and to engage providers. We do engage providers today through the acquisition that we're buying. And of course, we have, as a compounding pharmacy, very dominant in New Jersey, we have like 18,000 doctors. So we have a whole range of customers. I think what we need the capital for is to take all the capability we have. And obviously, it's hard to do 1,000 genomic tests manually. So computerize it. But we have the capability and we have the management team to do that. But we need the capital to really scale.
Barich, can you please tell what is the name of your partner one more time?
Phil Keogh.
Oh, Keogh.
K-E-O-U-G-H.
Okay, if you can hear us, can you please write down something in chat so we will identify you? If not, then he's not with us, sorry.
717 phone number if you're able to.
We actually need the name, and if your partner wrote his name, we can identify him. Just P-H-I-L. Yeah, I see.
Phil, right?
Phil. Oh, you didn't say Phil.
Okay. His first name is Phil. It's not okay. Yeah, and I promoted him so he can now answer some questions.
Himself.
Yeah, sorry for that. Phil, please answer.
Can you hear me now?
Yes.
Awesome. All right. I've listened to the whole panel discussion and the first two presentations as well as Baruch. So Sorry about that. It just would only let me on audio. Because I've been playing with this trying to get hooked in. What was the question where you needed
Elliot, is there any question that you want Phil to answer more on the outcomes and so on?
Yeah, if you could just add more clarity. I just think, you know, it'd be like as a payer or as a provider, like one of my questions would be really kind of understanding some of the adherence pieces of this, right? And the engagement, right? And some of the outcomes. I know you're early in that, but just curious if you could add some more color there.
Sure, no problem. Clearly, this is a big part of what we're doing. As I am a pharmacist by profession, so for me, all of this work has to build up toward proving better outcomes. Now, I know from experience and history that the more you can have someone compliant on whatever Medicaid or medical regimen you have them on, that you do get better outcomes. In this scenario, because we're going to be basically hand-holding these people through their health journey, which speaks to your stickiness question. We believe we can actually have patients for life because we can get them on regimens. We can put them in compliance packaging where, you know, right now all of that is very easy to do. I did it 10 years ago with Millennium Pharmacy Systems. For nursing homes, it was taking that same technology, applying it to the consumer. There is a huge pent-up demand, I believe, initially with the self-insured companies. I think we create a great base offering that we can go to them. And at the end of the day, it all comes down to the data, where we're collecting it through the DNA testing, the genomic testing, as well as the outcomes. Our intention is to, you know, use technology, take the data, and be able to then show the outcomes that we're looking for to actually be able to prove out the model. So then that's when you can go to payers and others with the data to actually then get into the national networks, where then you go from a great company to just explosive growth. So I'm very confident in the model and what we're going to be able to demonstrate. Early on, it will be more manual, but with, as he mentioned, our IT partner that we brought on, he's an internationally known stellar guy. It's going to help create this user interface, which will evolve as we go to, you know, help us with the whole compliance and adherence piece.
Bill, I have a question. This is Scott Amix. I'm looking at your LinkedIn profile, and I see that you were the president of Pharmacists, your Sears Holding Company, and then you were pretty much either the CEO or chief pharmacy leader at Rite Aid, at CVS. So I guess my question is, being that you really, you know, spent years in the pharmacy business, how do you feel that your business model is heading in the right direction from a strategy?
Great question, Scott. Yes, I've been a part of the retail pharmacy industry for a long time. And what I can tell you is this, what Baruch and I are presenting to you guys today, this is really a legacy play. This is creating the pharmacy experience, you know, to really help pharmacists and other healthcare providers work as a team to actually deliver at the top of their license. I think, and it is what it is. Traditional retail pharmacy chains are, you know, they're convenience stores with a pharmacy in the back. They've done a lot of great things, a lot of innovative things, but this is taking the practice to a whole nother level. And for them to catch up to where we're going, it would be very, very difficult. And I think it puts us in a position that this is, and there was talked earlier about the panel. I think COVID has really helped accelerate the acceptance of pharmacists in a greater role, leveraging the telehealth platforms and the other solutions that we're bringing forth as part of our platform. I think it allows us to integrate the patient with the experiences that they're comfortable with today. And I believe that we're going to be able to outperform the typical chain pharmacy relatively easily. You know, I think this is a more holistic view of the patient, and it's not just based on transactions in the pharmacy itself.
Just let me mention, I mean, as a pharmacy, our whole thing is really related to solutions. So we're not looking to do what many companies, if you go to Whole Food and you want to buy supplements, they've got like 25 varieties. We're looking to really bring in products that deal with specific issues and create protocols so we could broaden the market. So that's a big difference. So that's why we call it next generation apothecary, obviously, and obviously offer it in a digital way as well.
Can I ask a question as well? So you mentioned you basically have this consumer arm, but you'll be focusing as well on the medical side and reimbursement. Do you have some specific conditions for that in focus?
We're not trying to pigeonhole ourselves with just some conditions, you know, not just diabetes, not just, you know, high blood pressure or cardiovascular. I mean, this, you know, by leveraging our genomic testing panels, it's going to show certain mutations that's going to, you know, and we're also going to have medical intake so that we're going to be able to combine their profile to have an overarching view of their condition, run the test to see how that lines up, where they have opportunities, and then to lay out a protocol-driven plan that could, it may not always involve a product. It could be lifestyle changes. It could be diet and nutrition. We have a nutritionist on staff already. And then, you know, this action plan being laid out by a healthcare provider for the patient, regardless of their condition, okay? And then with our wellness coaches and our pharmacy teams, you know, hand-holding them along on this journey, obviously to get better health outcomes that we can then demonstrate to not just the consumer, but then to the payers ultimately.
Okay, thank you very much. I think that we got a lot of information about this promising startup from all members of the team. And time is over. Now, Mick, please show us questions. Yes, so questions about your investment interest in your life RX.
Thank you for the opportunity to speak with you.
Yeah, the next startup will be Serum Medical, and I already see that Rick and Jess from Serum Medical team joined us. And this startup recommended by 500 startups. So if Mick, please tell us, is it finished with Q&A?
Guys, we need more. Please
Yeah,
vote.
we have to wait a little bit. Rick, please wait.
Okay.
Guys, please be active. Do you see poll? It's just in front of your screen, probably. Only 10 people voted. Okay, 11. Good. Wow, 13. Wow, wow, what are you doing? Let's do it. Okay, 15 more seconds. Okay, last chance to vote. It just counting down like SpaceX Dragon Crew. 5, 4, 3, 2, 1. Okay, we are done. Thank you everyone who voted. And please be more active next time once you will be voting for Serum Medical. Thank you.
Thank you. Rick, please start.
Hi, hi, can everyone hear me okay?
Yeah, we can hear you.
And you can see the slides?
Yes.
Perfect. Thanks so much for having us today. I'm Rick Bieberman. I'm Chief Executive Officer of Serum Medical. Also on the line is my colleague and co-founder, Jesse Cordier. So Serum Medical is developing augmented reality software to help clinicians with pre-surgical planning by providing them with patient-specific holograms that have been derived from the same data used to generate a conventional CT scan or MRI. Our images are meant to be used in place of CTs and MRIs, and we provide far greater anatomical clarity. So we've all been there. We've had a child at the playground playing on the monkey bars. She falls, hurts herself, and has to head to the emergency room. A CT scan at the emergency room reveals an elbow fracture with a number of bone fragments. And for surgeons, putting these fragments back in the right place is like putting a jigsaw puzzle together. And oftentimes, many of these fragments fail to show up on either the CT or the MRI. And this causes big problems for surgeons because it requires them to make a number of critical decisions on the fly during surgery with the patient under anesthesia. needless to say, not many surgeons have confidence in their surgical plan as they head into the operating room. They know that if they don't get it right, there are big consequences. Malunions, deformities, surgery redos, just to name a few. 25% of all technical errors in surgery. And for patients, this means much greater risk of complications, much longer operating room times. For surgeons, it means lack of confidence in their surgical plan, inaccurate measurements, and inefficient image review. And for hospitals and healthcare systems, it means significant inefficiencies in how they staff and resource their operating rooms. So imagine, if you will, using an augmented reality model to get a much better sense of that elbow fracture, and then being able to virtually put that fracture back together using seromedical technology. This means less time in the operating room, less anesthesia, less radiation, and fewer patient complications. So imagine, if you will, also having these same images downloaded to your mobile device, again, using seromedical technology. So we deliver our models, our holograms, one of two ways: one through a head-mounted device, such as a Microsoft HoloLens or Magic Leap device, or two, through a mobile device, such as an iPad or an iPhone. Our software enables surgeons to do a number of different things. They can make virtual cuts, they can simulate corrections, they can measure angles, distances, volume, and bone thickness. They can pre-measure medical implants before they head into the surgery suite. On a telehealth consultation with a colleague hundreds or thousands of miles away, they can simultaneously manipulate the same hologram to make for a far more effective telehealth consultation. And then they can also do things like voice-to-text annotation and take 360-degree tours of anatomy. So we offer software as a service. The surgeon will upload the CT or MRI data to our cloud service. Using our proprietary technology, we'll take that data, we will transform it into a customized hologram, which the surgeon can then download for use in his or her pre-surgical planning conference, or download it into his or her office to have a quick look at an image before heading into surgery, or even sitting down with a patient prior to surgery to review clinical imaging for that patient's upcoming surgery. So this image here on the left, this image on the right, they're one and the same. We do not take doctors out of their workflow. What we're doing is replacing this conventional imaging with clearer and much more relevant imaging. So based on our pilot study at the University of California, San Francisco, around complex elbow fractures, we saved 21% of operating room time. This is in line with studies involving other 3D modeling techniques, which save between 16% and 33% of operating room time. This operating room time reduction leads to additional revenue opportunities. In the case of complex elbow fractures, we deliver another 90 minutes of operating room time, so organizations can run another surgery through their system during this time frame. And for organizations like UCSF, like Stanford, this means another $25,000 to $30,000 a day in additional revenue. Okay. So we're projecting a big market, augmented reality in healthcare. It will be a $2.7 billion market by 2025. We've been talking about the pre-surgical planning market. There are a couple of other markets that hold great interest for us. One is in the education and training space. Our images are currently being used at UCSF anatomy classes and in the radiologic technologist program at Foothill College. We also see use for our software with manufacturers of implantable medical devices who can use our software as a tool to help with rapid device design prototyping and as a business development tool. So, as I mentioned, we're software as a service. We're offering a tiered subscription model. We're initially focused on orthopedics, and from there we'll build out to other specialties. And then of course, we're selling to hospitals, health systems, education and training institutions, and manufacturers of implantable medical devices. So our first target market is orthopedics. Large market, significant procedure growth. In fact, over the coming 10 years, the number of procedures in orthopedics is expected to double. Orthopedics is typically the #1 or #2 revenue generator at many health systems, obviously imaging focused, and it's got a big Medicare market, which assures us a steady stream of customers. We are selling to surgeons. They will be our champions for adoption. So just a few quotes from our pilot study at UCSF from some of the surgeons we've worked with. First one said, this would change how I'd approach. The second one remarked, this improves confidence in my treatment plan. And another mentioned it gives you more information on how these elbow fracture fragments fit together and the relationships of the fragments. Okay. We have done extensive testing around accuracy and precision of our holograms. Our holograms meet the gold standard relative to CT and MRI. In fact, we're the only participant in the market to have published our accuracy and precision data in a peer-reviewed academic medical journal. So surgeons can take enormous comfort from the fact that the anatomy they see with our holograms is the anatomy they're going to see when they commence their surgery. So we've developed extensive intellectual property. We have proprietary methods of model creation. We've developed protocols that are specific to optimizing our models, specific to advanced hardware visualization, 4D flow, diffusion tensor imaging and animation. I've already discussed our gold standard model accuracy and precision. Okay, so we're sponsored by a number of well-respected organizations. We have been funded and supported by the University of California, San Francisco. We have created over 100 models at UCSF across 7 different specialties. We are in pilot studies at San Francisco General Hospital, UC Davis, the University of Southern California, and Foothill College. We're a member of Microsoft's Mixed Reality Partnership Program, and then are members of several accelerators, including CTIP, which is affiliated with Children's Hospital Los Angeles. We're part of Microsoft Startup Accelerator, and we're a member of the most recent batch at 500 startups. So in terms of competition, on top of our intellectual property and our accuracy and precision data, we're the only participant in the market to offer a made-to-order modeling service. We do all the segmenting for the doctors. Our competitors require doctors to segment their own models. We do not take doctors out of their workflow. Our competitors do. We're also one of the few players in the market to offer surface rendered models. Our surface rendered models provide much higher resolution and enable surgeons to take a lot of these critical measurements we discussed earlier around angles, distances, volume, and bone thickness. Our competitors offer volume rendered models. Resolution is not nearly as great, and taking these critical measurements is that much more difficult. So this is the team. I'm Rick Bieberman. I am Chief Executive Officer. I've been involved in digital health for 15 years as an entrepreneur and business development executive. My colleague Jesse's also on the line. Jesse is a pediatric radiologist at UCSF and has been on faculty there for about 10 years. Our other co-founder, Ben Laguna. Ben is a fellow in neuroradiology at UCSF, and Dustin Boyle is our software developer, and Dustin comes out of Sony PlayStation. Our advisors, Han-Min Lee. Han-Min is the Vice Chair of Surgery at UCSF. Karen Ordovas heads up cardiac imaging at UCSF. Stefano Bini, Chief Technical Officer of Orthopedic Surgery at UCSF. And our technical advisor is Sean Ong. So just a quick note on COVID and how we can help. So our operating room time savings enables hospitals to work down their backlogs faster. Again, around complex elbow fractures. We're saving 20% of operating room time. There is an enormous backlog of surgeries due to COVID. There was a paper published by the British Medical Journal recently, which estimated 28.4 million backlog surgeries currently. And then on the telehealth side, we enable surgeons to simultaneously manipulate the same hologram from hundreds, if not thousands of miles away. And this makes for far more effective telehealth consultations, not only between surgeons, but between surgeon and patient as well. So that's us. We're raising a $3 million seed round, and we're more than happy to take questions at this time. Thank you.
Thank you, Rick. And now time for questions. Dear investors, please ask your questions. Who would like to ask? Just say who would like to ask questions.
I'll jump in here.
Yeah.
Yeah, so wondering, the docs using this today, do they sort of adopt it as a total replacement to their current workflow? Like if I review 10 CT MRI scans, how many times am I sort of throwing the device on?
Yeah, so the way this breaks down is if you're throwing a head-mounted device on, chances are you're using that in a pre-surgical planning conference.
Yeah.
Okay, so they're reviewing. So as you know, Elliot, hospitals, health systems have pre-surgical planning conferences weekly or bi-weekly, and during those conferences, they're reviewing 10, 20 different complex surgeries. So they would be using our models for each of those surgeries. With the mobile device, that's geared more towards a surgeon who wants to have a quick look at imaging prior to heading into a surgery. Those tend to be less complex cases, like a joint replacement, et cetera. So those are one of our advisors, Stefano Bini. His bread and butter is joint replacements. He'll be using this on a regular basis right before he heads into surgery. The point of the mobile device is speed and convenience. So all he needs to do, take out his iPad or iPhone, have a quick look at it, and then head into surgery.
Thank you. More questions, please.
I have two questions. One is for Jussie and one is for Rick. First, Jussie, can you expand a little bit on your methodology that allows for that level of accuracy and precision in terms of transformation of CI and MRI raw input? And my second question, which is for Rick, is because of the fact that there is an expectation of accuracy and precision, even though it is for pre-surgical planning purposes, how do you mitigate some of the legal liability issues as it pertains to clinicians relying on these 3D holograms for, basically looking at everything from virtually sized medical implants?
Yeah.
Certainly happy to expand on that first point. With those exact concerns in mind, that's the way we started with our accuracy and precision data. We started off with American College of Radiology, or ACR phantoms, that are used for calibration of the CT machines and MR machines as our starting point for our gold standard, our ground truth. So we did physical measurements on these phantoms as our first step. We scanned those both with the CT and MRI scanner, and then we converted those into DICOM images that we would measure on an actual PACS station. So that's what I'm, as a radiologist, every day I'm doing measurements on a PACS station. Then we took those and converted those into a 3D augmented reality model. And we compared the measurements across all three of those platforms, both the physical measurements on the ACR Phantom, the PACS measurements that I'm using clinically right now, and then the holographic measurements. And we used both the same standard calipers for measuring that, and we also used the internal measurement standard on the device. And we found that there was no statistically significant difference between those PACS and gold standard and our holograms and gold standard. So these matched with that. And we did that both for CT and MRI. With that exact same thing, knowing that, if we want to say something's 5 millimeters, how close is it really to 5 millimeters? Because those differences matter. And this again is within the actual source data of 0.625 millimeters. So very thin slice data that we're able to get approximate, very close measurements with. And then Rick, I'll let you, if you want to.
Yeah, so on the second point, I just want to be clear. So we're not a diagnostic tool. We're obviously a planning tool, a reference tool. No, a couple of things. First, before we deliver our holograms, they're signed off by a board certified radiologist. So if there's a problem with the image, a problem with the hologram, that board certified radiologist is there specifically to identify it, to catch it. There's also, as you know, we're you know, the CTs and MRIs are there as well. So we don't, in terms of liability, I don't think it's a large issue for us. It's not a large issue for us. Again, we're getting board certified approval of our images before we deliver them to our surgeon customers.
To piggyback off that, similarly, the software that we're using to convert from DICOM to a 3D mesh is FDA-approved software, Materialize, which is 510K cleared for conversion of DICOM to 3D. So this is used in the same vein as 3D printing. And so we're using that same type of software to convert this to a medical 3D mesh. With those steps in mind, and just as Rick mentioned, you know, the liability would be the same as a 3D printed model or me measuring something on an FDA-approved PAC station currently.
That's a great point. Thank you.
Yeah, thank you, Scott. And do you have any more questions?
I have one. Just, I'm curious, just what are the proof points behind the pilots that would trigger conversion?
I'm happy to chat. So yeah, so really what we wanted to show is impact both on and level of clinical utilization. So you know, is this making a difference in both the surgeon's time in preparing or planning for the case? Some of the pain points through our initial customer discovery were that, you know, surgeons are spending a lot of their time in planning going through these two-dimensional images to try to make a 3D model in their mind. This is what I'm doing as a radiologist. That's what I'm trained to do. But for the surgeon, that's, you know, variable in how well they can do that. And so one is an efficiency in planning, something that they can use to quickly get that information. And second is something that's going to be impactful in the surgical time. You know, really this all came from my challenges seeing how things get lost in translation. And for a surgeon, those times under anesthesia, that time where they're what's called tourniquet time, where they're cutting off the blood flow to make a repair, those things are long because the surgeon is having to troubleshoot and figure things out in the operating room. And so really we centered these questions on how much of an impact will this type of planning have on the surgeon. And so what we felt is, you know, if this can improve their planning time and improve their shorten their time in the OR, then this is something that's really going to be useful for them to say, this is what we want to adopt. We turn this from a nice to have to a need to have kind of a thing.
Thank you. Questions? No questions. Okay, thank you very much.
Julia,
Jonathan. Oh, yeah, okay, Jonathan.
I haven't seen anything like this in the medical and surgical space, but I've certainly seen it with MR, AR type similar things that you're doing in other mechanical and other spaces. One of the challenges that I've seen overall is that in a very controlled environment, you can make a lot of tweaks and it can work. When, as you guys know, no two literal physical bodies are not the same. I mean, I can imagine on a, let's just say a heavy set, you know, 6 foot something tall person, and there's a certain specific surgical challenge that you guys want to discuss, overlay this mixed reality upon, maybe even practice on it, etc. The minute that you start putting these variables in, I've noticed it gets much harder. Where are you guys, just internally speaking? I know it's not insurmountable in the future, but where are you guys with these kind of challenges where you take it out of a very safe, controlled environment and you start using this more on the fly? You get a patient that comes in that's obese or extremely small, a variety of sizes, et cetera, et cetera.
Rick, and I'm happy to adjust it. And then, yeah, so there's a few things. So our focus is on the pre-surgical planning area rather than direct intraoperative use. But that being said, your point is well taken as far as variability in patients. So, and exactly right, an obese patient is going to have different type of imaging than a pediatric patient or a young, thin patient. That's where I think we leverage our expertise as radiologists. So as myself, I know how to optimize a protocol to make sure that we get enough signal to get a very high quality image. That's where we bring in that proprietary expertise, that level of subject matter expertise, and how to get the best CT that's going to translate into the best hologram. And knowing those variabilities as a radiologist, I know how to protocol something on a GE scanner versus a Philips versus a Siemens, because there's all those little intricacies that are different across sites. And fortunately, having experience of work with all of those at UCSF, it's able to give me insight and to be able to how to optimize things for getting because it just exactly right, sort of is garbage in and garbage out if you otherwise don't have the good source data to begin with. So that's where we bring our expertise, is knowing how to get the best out of that imaging in the first place. And Rick, if you've got other points too.
No, again, so just to reemphasize Jesse's point, so we're pre-surgical planning. Rather than intraoperative, and I see that issue is critical intraoperatively, where they are doing this kind of imaging on the fly. We're not doing these things on the fly. Especially for the complex cases, these things are being downloaded into pre-surgical planning conferences where what the surgeons are doing is quite deliberate in terms of evaluating the image. And making judgments as to how they're going to game plan their surgery.
Thank you very much. I think that's it, and time is over. Yeah, here is questions already.
Okay, great. Thank you so much.
Yeah, thank you so much, Rick and Jess. Mick, will you count this time?
Right. Well, right now it's more active actually. And we see some progress in 13 people already voted. I was curious, like some people told that they had problems to vote. Does everyone see it in front of their, on the center of their window, like everything there? 14 people, okay. If you have problems with voting, please tell us in chat. We just want to make it as smooth experience as possible. Guys, it's well, we are doing events for a long time, and we want to make it like the most ideal event as possible. So, and hopefully you like it and enjoying it. So, yeah, and we have a couple more people. Please vote. We want little bit more, maybe 20 more seconds to go, and we are done. And meanwhile, we have Howard already almost ready from BFF Biomed. Howard, are you with us?
Howard with us. Yeah?
Yes.
Yeah, cool. And you will be sharing your screen in a second, right? Presentation.
FB Biomed, please show your presentation, and we are going to start your pitch very soon, just in a few seconds.
Okay. Yeah, guys, last chance to vote, and we are done. Okay.
Thank you very much for your feedback, and thanks for your positive feedback to me personally in chat. So now, Howard, please introduce yourself and your startup.
Hello there. This is Howard Dernovitz, and I'm. Can you hear me?
Yes, we hear you and we see your presentation.
Great, fantastic. Hello, everybody. My name is Howard Dernovitz, and my partners Julian Ray and Stephen Ernovitz should be on here, and we're FBB Biomed. And if I can jump into our presentation, the bottom line is that we have a pandemic occurring, and the tests are terrible. The scientists, this is from Kaiser Health, they're calling it the Wild West. On our weekly FDA call, we basically are hearing the FDA talking about how many tests they're pulling from the market, and it's needs help. It needs our help from the biotechnology industry. And so what our test does is at FB Biomed is we're in a unique position where we're asking just exactly what's going on in this patient, and we don't want to pick and choose our favorite virus. We want to sequence everything. And so our test looks at the immune system, not just the virus. And what makes us unique is the tests available today. Antibody screening tells you whether you had a past infection or not, or you may have a current infection. And that the viral load test tells you whether you have a present infection. So our test, since we measure everything, is we're looking at your immune system status. Are you going to get a disease or not? Do you have COVID-19 currently? And the other thing is, what other bugs do you have? I was alarmed and ecstatic to hear on the FDA call this week that they said they would look favorably on people that were going to try and bring through the FDA tests that look for other respiratory viruses. That imagine you're the physician, you get the news back that your patient doesn't have COVID-19. But the question then is, well, what does my patient have? So that's what we're going to do, is we're going to finally build a test that can give maximum amount of information to a healthcare provider with minimal impact on the patient. And so our novel clinical utility that we're presenting here for doctors that are on the front line is we need to know, is my patient suffering from COVID-19 infection, or does the patient have a damaged immune system that we should anticipate what's called a cytokine storm, where the immune system just basically blows up and moves to severity. We want to be able to index the severity from these cytokine storms. And then what if this patient has a treatable co-infection? That is, in fact, one of the reasons why the disease is so severe is, can we tell you that there's a herpes virus where you can give a antiviral, or is there a bacterial infection? And then which personalized therapy should I recommend first for my patient? Well, that's based on the report. And is my patient responding well? Well, this is a test that's not just a screening test, but we'll also monitor. So if you're doing well, if we're doing well, then you have to go ahead and see the biomarkers come down. So next slide, let's see. Okay, here, now. So in here, this is a table that basically breaks out for you the where this test fits into the landscape of the testing menus. So with our approach, we want to be able to make sure that when a patient comes in, that you have the greatest possibility of knowing that the patient has COVID-19. You want to know quickly, within a 2-hour time frame, and the infection status of what other bugs are in there. And then, is this patient going to have a cytokine storm? And the confirmation test we'll do is, if we get a positive that it is a COVID-19 or an actionable item, we will then simply morph that into a confirmation test, which is a full blood draw, and then that takes less than 24 hours. The first one's less than 2 hours. And then the convalescent test is to monitor the patient for the duration until the patient can leave the hospital safely. Note, please, that this test is for everything. It's simply the same test because we're measuring everything. That when COVID-19 is finally contained, we hope so earlier than later, we're still going to use this same test. We've started out originally with multiple sclerosis. We then added on proof of concept studies for Alzheimer's, Parkinson's, and ALS, and that's the basis of our intellectual property we'll be filing shortly. And that this test will be the same, is we'll be screening for you for whether did you start Alzheimer's. And my guess is we'll know that 10 to 20 years before you actually get to the severity of the disease. And the confirmation test will let us know the severity, and then we can monitor therapy. This gives a target for drug companies to start going after. It's modeled on the same HIV AIDS model of once you have a target, you can then contain the virus with combination therapy. The various different prices, a screening test needs to be cost effective. It's usually $50. We'll add it on to existing COVID tests, so we add our severity index. It's called a quantitative PCR test, less than 2 hours. Here it's a royalty model, so there is no cost of goods involved. In the confirmation test, this goes to next generation sequencing. So we sequence everything, we get an answer, and these tests now, just to let you know, the prices are coming down. It costs about $1,000 to do the whole human genome. We can price this at $900, make 40% margins on this because of the fact of our proprietary test enriches for sequences that we can bring the cost of goods for sequencing down. So unfortunately, when we looked at this in February and we're asking the question, how bad is this going to get? I think we're all in a spot now, this is bad. And the thing that makes COVID-19 really bad is the fact that it can cycle from humans to animals and back to animals, back to humans again. So we're going to have to be testing for at least the next couple of years. Healthcare workers, people that are in elderly care, people that are the education, schools, teachers, public transportation, allies, retail business, oil and gas mining, food processing, delivery, restaurants, and hotel. This is a large market that needs to know that it is not coming down with a second or third wave of the COVID infection. The testing model that we use is you test, you treat, and then you repeat. And so we collect at the site of origin. We believe that there's enough material in that we can eventually get this to a finger stick test, but then extract the blood. We run it in our proprietary chemistry, plus with our proprietary bioinformatics pipeline that we had to design for these kinds of infections, and then produce a clinical lab report that just clearly states to the doctor what is the interpretation so that the best clinical decision can be made. So the revenue, as I alluded to earlier, is the fact that we will do revenue one, we'll license out our IP. We have proprietary primers for COVID-19, for the various different other virus infections, for the cytokines, the immune system status, and we'll cut that deal with large lab service providers that will work on a royalty stream. They just simply take and license from us our sequences they can put in their platform. We'll get license fees for it. There'll be clinical useful testing and better outcomes for the patient. So this is ready to go on most genetic platforms known as RT-PCR and the like. Let me see next. Here. Revenue stream 2 is dedicated to the fact that we're going to have our own CLIA lab, and this is where we'll do our NGS testing. The drivers for this is patients, better patient outcomes. What will sell it for us is key opinion leaders. We're doing a clinical trial for the COVID. We're honored to have the dean of the medical school here at the University of Iowa be the principal investigator. The chairmans of immunology departments in Europe, Germany, all have joined us. And once they see the data, these will be the people that will sell our test for us. Medical centers and doctors, they'll get interpretation fees. No new lab equipment will be necessary. Lab medicine, we want to get on the catalog of the various different centers so that the doctors can order directly from their catalog, and then we will take the samples in our CLIA labs. And insurance companies, we expect to save a lot of money for people, the fact that we can diagnose people quicker, the fact that we can be able to then morph it into the neurologic diseases and start really attacking the chronic diseases as should be attacked given the technology that's available to us today. Where are we on our milestones? We're on our milestones that we finished our preclinical study. We know the markers we want. We have signed up IQVIA as our clinical research organization, and we'll start collecting samples probably as early as next week. We'll unblind them and apply for emergency use authorization from the FDA, get clearance on that, and commercialize our test as soon as we can. Gray zone here being that wiggle room of what we have to get done. Milestones, provisional patents are being organized right now and will be filed shortly. Close our licensing deal with a large lab service provider and get our FDA clearance on the test and begin our royalty revenue in Q4 of this year. We've launched a multi-site clinical trial for FDA clearance, and I'm sorry, Julia, that I had sent you this slide yesterday because we now added Italy to this. So now we'll be collecting samples from the United States, the United Kingdom, 3 spots in Germany, and now Italy. As I said, the Dean of the University will be our principal investigator, and our clinical project manager is the very talented IQVIA. What a great CRO. The bioinformatics pipeline has been tested out on another viral disease, and we're ecstatic about the results. And we've already been in contact with large laboratory service providers to keep them up to date on the progress of our clinical trials. I myself, well, quite frankly, I got a phone call from colleagues, bankers, everybody I know on St. Patrick's Day of this year, and they just said, Howard, you have got to get back in the game. The reason why is everybody knows, my colleagues know that I built 3 FDA-approved tests for HIV, another epidemic of 30 years ago. Rapid test, 10-minute test, the first one, and 2 urine tests for AIDS FDA approval. I got my PhD in RNA virology, good career selection back then in Ann Arbor. Julian is on with us. Julian's our Chief Business Officer, comes from the business of doing artificial intelligence, and he's got his MBA from INSEAD. Steve Ernovitz is my brother. We've worked together for 30 years in 3 different companies. We builds remarkable laboratories. He built me an FDA facility for our first company. He's our co-founder in here, and was honorably discharged from the U.S. Navy. And my long-term friend and colleague of 35 years, Gary Neal, Chief Science Officer at Cerecor. He was at Johnson & Johnson, Chief Science Officer for 10 years, and he's an advisor to the FDA, an MD from Saskatchewan. So our intellectual property will cover the novel RNA sequences. It will cover structured data in bioinformatics. We have already found now that we have COVID-19 intermediates. We will find sentinel RNA. We found genomic hotspots that are indicative of a immune response. The structured data will merge test results with the clinical outcomes for machine learning. There's a lot of intellectual property there. And then the bioinformatics. So let's face it, we go into the junk that sequencers throw out, and we say this isn't junk. These are microbes, these are immune system mutations, and these have clinical utility. The IP enables multiple licensing opportunities. This is what we've heard, personal diagnosis for a long time and just waiting for the technology to happen. This is personalized diagnostic. We will work with the drug companies to develop pharmaceuticals that will be able to be tested by our diagnostics to say whether it's working or not. We'll have predictive algorithms, so when we get a report back, we can say, here's the best treatment for your patient. And then the best thing of all is, with all of these new immune markers we're finding, it turns out that there are a bunch of therapeutic targets. We will then pivot back to where we started, which is in the neurologic diseases. We now have data that we will file in the, we will file it into areas of Alzheimer's, multiple sclerosis, Parkinson's, and ALS. It turns out by taking this approach of sequencing everything, put it in our proprietary bioinformatics pipeline, we will have screening tests, we will have disease severity tests, and we'll have monitoring tests. It'll be an exciting project, because it will meet the criteria of what our company is based on. Is we believe that one life and one test. This is one test that simply measures everything. It's basically the Hubble telescope of diagnostics, and what will come from it, we believe, is great clinical utility and hopefully game-changing for the medical community. I hope you heard me.
Thank you, Howard. Yeah, thank you.
Good. Thank you.
Time for questions.
Okay. And
Thanks,
Julian,
Howard.
if you're on, Yes.
Yeah, thanks, Howard. This is Scott Amix. I have to jump off, so I have to ask my question very quickly. In terms of your approach, how do you know that your approach is the right approach? What kind of market validation or proof points are you seeing in terms of whether it's early signs of sales or licensing?
Superb. So our goal is to have a published paper from a clinical study. That's why we worked quickly to get the right people, the best people, to put together a blinded clinical study. When the results are then unblinded, we will A, hand that off to the FDA, and then B, publish it as a manuscript. Once you have a manuscript accepted, then you and you have a CLIA laboratory, then you are following the de novo 510K FDA route and be able to make sales immediately.
Thank you, Nicholas. I see maybe you would like to ask something. Yeah, no? We cannot hear you. We cannot hear you.
Sorry, can you hear me now?
Yes,
I can.
Yeah. No,
Yes.
this is an interesting model. I'm really interested into the channel you're going to use to scale the business.
The model we're going to use. Well, I look at the CLIA lab business as modeled after the, once they had their clinical studies published, the very well orchestrated rise of Myriad Genetics. I know Myriad, I did a deal with Myriad Genetics. They basically had one test, the BRCA1 test. Were able to achieve several hundred millions of dollars in revenue. I believe they're up to $700 million in revenue in risk tests. And so I think that if we model what Myriad did very cleverly, and critical component is reimbursement. And so we have to make sure that with FDA clearance, that we have to work with various different insurers to make sure that we have a reimbursement model that's consistent, that we can prove to the reimbursers that there's immense cost savings by buying our product. And I think that's the best model out there.
Jonathan, would you like to ask something? Jonathan, would you like to ask something? We cannot hear you.
No, thank you. Right now, I appreciate it, Howard.
Hello.
Hey, Howard, I'll chime in here. I'm just, easy question here. I'm just wondering, how much capital do you think you'll need along the way to get through to the neuro? Yeah.
Yeah, so well, to get to the neuro, to get through the COVID, we have signed a term sheet for $4.5 million to get us to marketplace and commercialization. Our original model was 10 million to be able to bring out at least multiple sclerosis to the marketplace. And but now that we have therapeutic drug targets, we're reevaluating our financials to ask the question is exactly what is the strategy? Because as you know, you got to be extremely careful in how you're going to bring products out. If you don't focus and get on the marketplace and have a well-designed strategic plan and a commercialization plan, it could all blow up. So what we did was we picked neurology because that focuses our sales force on one market, one patient, one client, the neurologist. And so if we can keep going back and using our sales channel to constantly be giving new products, adding on new products, here's a new indication that now as you're seeing Alzheimer's patients, this is what this does. So we need to focus. So 10 million is our sweet spot to be able to create a sales and marketing strategy for the neurology market. We'll bring cancer and autoimmune diseases on later. Also, in the last couple of weeks, we just realized that we can, in fact, test for every virus and bacteria there is by sequencing everything. So we'll have to have a strategic plan for making sure that we have a test for the infectious disease market. And quite frankly, this test should work well enough that we should never have a pandemic like this ever again. We will know in advance by setting up sentinel studies with veterinary institutes, World Health Organizations, and the like, that if anybody has an RNA molecule pop out of whack, we're going to start looking at that. And if there's a new infectious disease person, that we will be ready, we'll have the right devices, we'll have a 3-month head start, so this never happens again. That's our mission.
That's
Great question. Oh,
I just said that's helpful. Thanks.
Thank you.
yeah. And also, I hope it's true.
We all do.
This was last startup for today. We are a little bit longer than planned, but not too much. Mick, please show us questions. So yeah, last questions. While you are voting, while you answer questions, let's say, because it is not some contest, I would like to remind that we are excited to build such a great community of inventors and entrepreneurs and investors in biotech, health tech, digital health, longevity tech areas. And we provide deal flow consulting for startups and investors from these areas. If you have any questions about this, please ask me. So I would like to remind you that we will host a virtual biohacking congress on July 17th, and I will send you a link, and I hope you can join us. There you can learn from first hands and meet like-minded people, friends and partners. And if you are not biohacker yet, you can start your biohacking journey for health optimization, performance optimization, and longevity. We like all this and believe that it's powerful. And yeah, we invite you to join us.
And I just posted a link in chat, so you can go directly to our website to see all the panelists, schedule, and startups who will be pitching on Biohacking Congress. A lot of panel discussions, a lot of keynote speeches on biohacking. So join us there as well. And there's still some place for partnership opportunities. So if you're interested, go ahead and contact Julia. And we are done with, I think, was Paul. Any last chance who want to vote? Okay, we are done.
Thank you very much. Yeah, thank you for being with us. Such a great startups presented today, and I hope that some of you interested in investment, we will follow up. Thank you very much. I hope to see you again at our next events, and ask if you have any questions. Thank you very
much for
Thank you, everybody.
Thank you.
Bye.
Thank you, everyone. Have a great day.
Have a great day. Bye.